I'm studio in Damaso Quanson, because I assume one say hi Accra Digital Center, and a special program today is a sectorial debate. Bro. This is the second episode. Majority Sabeka say now community temni and Koma Edi Wasem was in relation to energy, power, and in major political parties among Bedi Hong Kong editor. And this very week. I ne fiade anope 7:30 to 10 a.m. Yede brono ade ba ko ehia yie pa eye apomuden wonsem. So this morning our discussion is on health. Apomuden de ehia mo bia. And as we count down to go and vote on December 7th, your election headquarters, Kokromoti Power, through Badwam on Adom TV. Ishene say brano na otwi mienu ntambia no ye de nkoma efa various sectors no ebebro enu nti ne ka cho say ye de sectorial debate ana ebro ne fa pimnyina na ye enkuntabu party A na adwini mu no bre onya akwanya betena so no de oye efa apomden wonsem say onya akwanya asa babie ma eden anobe de ato so, in this case referring to the NDC. Party B, that is the New Patriotic Party, Otiabemu, Eba Pomudin Komodie, Nin Sachra, Nin Puntu Audua Eba, at the end of what my yafa. Now, all pressure obe breaki 8 national, at the end of the day, go a Pomudin sem. And it's going to be very interesting. Go, Ahano, near bread, de beye, a ye de be breathing to a trouble baby any. A yadia, o speaking to a Nyoma Wabeya, a woho. Ghana for betimi ho na wona kenkan na omo feeling so etidie hia ne say one matter in this business of health, a nurse for, a doctor for, pharmacist for, menu any eku ahodo midwives for eku ahodo nyina kasa fa apom de wonsem no enne anopai won so be kan say one say said be ya mpanyimfo ato nsa from representing these two major political parties no. MPP Dr. Insia Asare and then NDC Dr. Bayu and Professor Bayu the Baba represent you. It tells you it's fully packed. Oh, fie baby abutu biana akwenya beba betoama via Zoom or selber friends so a year ahomaso. Mekao say we are live on Adom 106.3 FM. Anafi Adom TV so or share or constant so. But the man here come Nasan. Jumedi is put together by Welbeck Kofi and Pedu and the entire team, camera, sound, lighting, set designers, one in makeup for the driver for one day banner pay. We are so grateful. We thank you so much for your time. We are hopeful, say, by the close of this program, sectorial debate in Kuntebu Papapano, now what you baby. Okokromoti aye power no ebetimi akọ now they are team on December 7th. Minimum you ma fiam ankwata makro na afia kwasinsia ene obedisa enkomo we nyina baka o se ebribia da no bra ye be ma mpemfo aka wasem no akwasinsia enya akwanya emaye an overview of eya apomodin wonsem said yes yakọ na no da oti energy baby odi ekọ fire and no pension no exactly so obekire nioma apomuden obo ni frede obetima ka say A B C D E F we there e wo hoda da answer and paying for abetresa ehienim. I'm sure it's going to be very exciting, educative, and of course very, very interesting. Making why a crowd was so pursue who the BC and Edia Jibre from now to 10. Maybe you know Ukraine as I trust Ukraine by 10:30 near anywhere this ankomo. Medasi P the 26th of July. So on your dinkomo. May go straight to me. I was marching. Me just what mine. Bibia come Boko answer. Good. Nyamiadum just that sometimes you know. Oshano Panana Bibika Krebi one I say comes Bauti in Semna Metias. What kind of Cosiajiman? No quite Metias. Yeah. So catch you be saying Metias. Yeah. Now you are dancing your Bezudin. Oh, sure. Untiasia, Aquasitias, Aquasiajiman making. Yeah, what Yametias. A catching tray. A catching tray. Yeah. Unyametiasi. Once no be actually on a catch. Untiasi. No be so actually be a good father. Untiasi. No be so actually a good brother. Untiasi. They who back up sunipa. They who catching tray. They who pan sunipa. And a catching tray. Catching tray in a day who no sunipa. I was here this uncle to see. Yet we see ya. Unyame. I anɔpɛ dem sɛ wopɛ sɛ otu fɛ wiem.
Ye wo me say. Nyame ahyɛ no mo nyam.
Onyame ahyɛ no wɔ ne mu.
Esa day another 2 weeks asabe to ebie for a sectorial debate.
Wow.
Yeah, man for ba be hunu Ghana apomden. Baby a free kwasi bro ni fita epeso ebesi bra yankase agye ye man se ye behwe yankase ye man ne ye efa apomden eho ensem ho ne ye tim dia kan ne abrofo ndi agya yen ne ye to sini ewo mu ene ye ko ye ni mu ne ye hwe ni mu se sabetimi aka ene ya de se na boss no these two political party reps no ba ba kyerɛ yen baby o mo de o man no ebekɔ se eba apomden eho nsem ba ya kakra de ye nim na yakenka de free penfo kratam ne bebu hu konta mamafo nyina wo se Ghana apom de na eka wasem ne su ne ban sei ena etie aspiti se kra ne wo ewo man mu a doctor for se ne wo a nurse for sei empo labs awodo sei ene wo oman enyina emu to ma won komo e ba be de na no pai na mamfo hunu se ne Ghana yapom ne akasa ne su ene ba etie.
Well, Akwasi Akadem say also I crowd or be walk here through 10-12 minutes afterwards. We are now paying for a show Dialysis na various this is under the health sector no one so team do one come at all kai say enye kama minke bi da bi me NDC me de me buy me be and me press me sa ba biem no de metimi aye me MPP de me buy me wosu me ye na fe meet me break it na me ye account nti nyaade a obi be ye watu ana account 2 minutes na we ho nti na yensi am na mu fo no through these various agencies and specialized ones no ebe gina ya na mu na yetibedi nkomo ebere ba mu so amadi ka hye obo obenya akwanya na watimi afre and I say ya frɛ wo Zoom so now so watimi ne yedi eyenkita. If you are ready, just let's go through what the overview looks like about the health sector now.
Okay, my answer me mama for ehunu obi kai the data and the figures behind Ghana health sector no. Ye ka say yapom ne ehye no efri baby na eba way back abrofo no ebeje Ghana e de ekente so from the Gold Coast ebre no. Some of the health centers no see na akoye biaya na ewo ekrum ekura kese mu it one na won krum kum na yenhye da any access to healthcare papa bia esa until nemu na mpenfo ye bia de be see 1995 abekai the late Jerry John Rawlings declared say the vision 2020 now vision 2020 ne say twa another 5 years bia na ye say de hwe yapom den ehonsem yenya 5 thematic areas epese ejina so near the boa epeja Ghana apomden esem ne say de edikan ye behwa make sure say apomden betimi akọ Ghana ni bia aboboa ne beben wo yi se de be ya so how be eto apomden esem na so person nya ayaresa unkotwa kwantenten entimi emfa enkom now ye na mo anaja ye sa de ba de be see eye mampenda da akofo epeso ese sabre no na amanfo isi kafiri ombotom ene ye de ekwakope apomden now so 2003 mampenda da akofo ene mpedfo share say ene ye fa bi e friend health insurance emra so it takes about 2 years and they build the health insurance so from 2003 to 2005 it take effect no and if be the mutual health insurance say e be kate across Ghana baby and this will be obia no who was health insurance now obetimi akọ eye apomden and they did mu ade bedu baby o man ya babedu baby ya babedu afi yanko ne mamafo ehunu senior Ghana apomden no akasa esimi etie sa wo hwe se na Ghana apomden esimi etie sei na timam chop the graph no send your map no akasa esimi etie mamfa the next slide no efa emaw now say wohwemu a emprepre ye kasai as of 2022 na healthcare budget ya Ghana e dey bo ya pom ne hu ebra e about 10.9 billion Ghana cedis na say medical catch ba bia ye free eba ya tutumu anaja ye de ekọ ye mu anesam as of 2022 near 11,079 public health facilities na say apomden bia eye aban edia as of 2022 na ye 11,079 now so far by 2020 na doctor ni bia hwe nipa 10,000 as of 2020 na doctor ba ko bia hwe patient as of 10,000 equivalent to nurse ni bia no hwe patient bia na nurse ba ko hwe patient be say 10,000 as I mean fan call the next one again we Adia Ghana Health and Pen for and the Amayanti a young Unisano. So this budget number was so at the external. Remember, the number of ambulances was says about 337. Kase na as of 2019. Na those 337 no because back year 2019 president for the air commission 307 and back the 55 effective ambulances are or better year as mampenim it is peja no somewhere 360 but a beer break it down according to Auditor General's report it would year plus or minus in every mois a benya best 337 now before 2019 na ofa ambulance ba ko bia na ehwe enipa 540,000 before 2019 now for ambulance ba ko bia na ehwe patient 540,000 by a benya 307 be count be drop it from 570,000 to one ambulance to 84,000 patients. Though you know baby World Health Organization pen for share echo social World Health Organization for share na I say ambulance ba ko bia serving patient 50,000. As we speak, Ghana here not less about 250 more ambulances. As it's mere meets our threshold now. Ghana Health Service and pen for the Amayeno. So this is the whole figure of Ghana. Yapomni I was have go into details. Now Yababeshe send ye hospitals out on etie send ye aspiring across Oman Enyenemu. So now as of 2022, as of July 2022, this is number of health facilities are near medical canina actually say na uichema nchemu no ATM ukwa Western North regions are ye wo abaya sabia makumako 410 for Western North region 410 and aba Western regions were ye was 733 public health centers and now Volta region is 652. Upper West region is 533. Upper East is 680. Sanso and Savannah 235. Oti region is 311. Northern region is 578. Northeast is 165. Greater Accra region is 1,445 health centers. It has to be a hospital, be a clinic, be a polyclinic, Canina, and Adom. Eastern region 1,435. Central region 817. Bono East 426. Bono 512. Ashanti region 1,922. Zufa Ghana, baby, what a pomdim biakasiepa a santimantemu. Your health centers mark 1,922 na wa asante mantemu. Ahafo ene kuta 225. Now, out of 2020, according to Ghana Health Service, you have the number of health personnel are na yawo. It will show blue a dentist, one na a sing, any what physicians. I don't have somebody for your pharmacists, one na emma enro ewo ayasabia ahodum. As of 2020. So this is side from 2017. Out of 2017, not dentists what Ghana nyina 594 Ghana nyina. Out of 2017. Now, about physicians are now 4,016 physicians are near what as of 2017. Out of 2017, your pharmacists in 674. Share numbers ni ye a bit rise, a bit drop it. Now you're moving to 2018. This is to a population of at that around 30 million. Before the census no, into 2021 no, this around 30 million count. Now to 2018, the number of dentists moving from 594 to 610 out of 2018, and the physicians moving from 4,016 to 4,424, and a pharmacist drop in 2018. A dropping from 674 in 2017 to 617 in 2018. Now, in 2019, there's a rise, there's a fall somewhere. So, in 2019, the number of dentists are near war in 2018 is 610. But in 2019, there's a rise to 625. And the physicians are dropping about 4,017. Then yɛduru pharmacy so no maintain ye ankosro amafom. We had the same number. Now for the last one 2020. So 2020 is yenya rise kakra ensu ewom. Dentist rise cost 642 as of 2020. Now dentist Ghana is 642. And now 2020 krona so no you're dropping the number of physicians here my emu. 2020 you're dropping the number of physicians. Dr. Franka say no a drop from a social 2019 a rise to 4,254 in 2020. So 2019 it was 4,017 and a rise called 4,254. And now pharmacist in 2020 and so a drop here one ma enro ewa ya sabia awodro no a drop here from 671 in 2019 a do 2020 na one ma enro ewa ya sabia no abedu nipa 593. Now for yanko the total number of hospital beds near no bed syndrome because hospital you say empeny wo ti o se me da form stretcher so and also doctor for ehme. So ye baba hwe sene na Ghana ye hospital beds etiem from 2017 to 2020. Now as of 2017 now ko hospitals out where ye aban dia ye betimi bu nkonta na empa e won ma kwa ya sabia betimi adas Ghana nyina eye 18,419 2017. Now 2018 a drop here because a bit say amfa bi anhim and a drop see 18,276 by 2018. 2019 abampen fokope and penny b and the beka home. And a man peja at the call 18,436 beds. You drew 2020 na do one asa saying. It is a drop here to sorry graph now. If I say now about say Nedo Abba say it is a drop from 18,436 to 18,155 beds in 2020. Say that here. Now the number of nurses are nurses for a shaying a war ayar sabia awodro. By 2017 na ye war a nurse for 48,939. 2018 emu epeja edekoye to 52,605. 2019 esapeja ko biem to 58,608. And at 2020 epeja de ko 66,097. Some no can say I drop it pa. I drop it because one Ghana buying UK buying assign contract. Yeah, they are nurse for free Ghana echo UK mo ye adwuma legally. And a Ghana nurse for being so enya akwanya ako UK. You almost some send nurses. My numbers no I drop it pa. But him penny for say or me who adwuma tuni betie how am penny for be fill in the gaps no e nyina anya hu. Kwa be fa so betimi nya sa nurses na every system no e de ekom. Afem do ko the next slide na ehwe ade eso e wonom. Yegusu e kire say the Ghana pom din e wonsem etiem. Now we sa ba bia no adri eye yare a ekum Ghana de hye. Yare a ekum nipa o ya safa na nyina ene yare a ekum nipa pa e wa bibre mantemu yare adu. Me focus on Ghana because Ghana on common na yedie. Se na bia so ahwe so no. Bon yare awdo a ekum nipa pa e wo yeman emu. So as of 2019, so this from Ghana Health Service for report na yekin kan e de amount. As of 2019 ya de ekum Ghana for pa na yedi kan malaria 10%. And so tuntumi ya deba. Malaria 10% of our population ewu because of malaria. Then stroke 8% of our population newu or Ghana as of 2019 because of stroke. Now near freno humi engia enkoye sen humi enkoye near about friend lower respiratory infections. Let's say it seems to be about humi no emu. As nipa ekumo as of 2019 8% of your population. Now neonata me can say neonata say nyina yenim sa akọ ayasabia nema ensisu ye dia babe ta okọ enso 8%. Ena heart diseases akumayade enso eteki about 8%. HIV AIDS 7%. of our population. Nipa na ewu Ghana pa as a result of HIV/AIDS. Na ye 7%. Tuberculosis and teshewa. Cool. Now so 5%. Diarrhea 3%. Diabetes 3%. And after others and so best 35%. But all the total send we are saying na ekona. So we are said no near edi mu akumaya de NSA kum ni papa we are same. Near to also stroke send Ghana stroke and kum ni pano. To say you never send a bit me aboa amakwe bit me afa so ma stroke no ano abras bit me to one more. But oba bibrem hanum near ekum ni papa the neonatal disorders and after the tos beam and sa humia ensisu no baba Ghana humia ensisu no number 3 but a bibrem de number 2 man fa ko that last one afi me no enwie many catches way Ghana Health Service for reporter yes I can and making kind of send be ya bo say report na the no a reporter man fa ko the next slide na afi share ade enso honum 80 Adom so amount send the expenditure scale the ewura your health sector emu. Now say over Adom out of the $2.4 billion you're spending on health no our Ghana nyina no. When I call Abaya Sabia consuming 42% of the $2.4 billion you're spending here in health as of 2021. And our private sector so you have 58%. Now, in Ghana, registered physicians in Ghana, 4,254. 4,254. As of 2020, this is a Fish report. We so a Fish for a so certified and American at the bound. Now, about private hospitals as of 2020, now Ghana were 194 private hospitals. Ghana as of 2020. About public hospitals, now you were 91. It in part also medical catch say, okay, or by winning about health centers, no, hospitals, polyclinics, and clinics and Ankasa emu. But I mean, hospitals, Ankasa, your friend hospitals. Ghana as of 2020, there were 91. Now, surgical centers, so no, out of 2020, there were 516. 516 and na ye wom now say wo hwe consumables ye didi djuma e wo ayasabia as of 2020 and this report by the Ministry of Health, Fitch Solutions, World Bank, World Health Organization of Ghana Health Service. So this report I make animal and this are the source. The Ministry of Health, Fitch Solutions, the World Bank, World Health Organization of Ghana Health Service. Now, consumables said the year a juma ewo yemai emu as of 2020. And so any share other consumables na 3%. National Japan outdoor about 8.5 million. Then materials outdoor the year juma hospitals no and so your numbers 0.4. Bandages outdoor the year juma so the best 10.6. Just say yeko yanim enkakra yeko yanim enkaka. Niamdu eba be wie next slide am do ewie enso eniem which to me ma wo hunu se na Ghana ya pomden ni suno enyina esimi etie se na Ghana pomden esuno esimi etie na mo hunu se ye free baabi abra abrofo ni gya ya na ye health centers no ewo enkro akese mu enes ye nyama health centers no bi benyen but so hwe ni padodru ewo obamu ye twam 30 million and the number of hospital do I war polyclinics I war clinics out do I war now teams are still ye more medical somewhat as I say about ambulance and so on. Yes, you're moving from one ambulance to 540,000 patients to one ambulance to 84,000 patients. But still, you meet that the World Health Organization threshold now, and you one ambulance to 50,000 patients. No, so it means money here not less than 200 ambulances more to top up. Yeah, already ambulances now. So this is the general overview of Ghana. Ya pom de send etie. We our command and pay. Yeah, but ababedi. Simedika abobuwesu area. So the health facilities per each region. Ashanti region leading with 1,922 health centers. Mikael said there's the hospitals polyclinics na African clinics and Kasanso so the list yeah, the northeast region, you have 165 health centers. So we need to check the population there. Near say esun or say apno. Kwame bet me afaswa happen. To one come about bedi and benfu ba be chire yen kwame bet me afaswa. Ye bet me ape on sa esinto aba our your health centers no enyinem. So enti way any your sectorial debate, the second edition, yeah, a year on health. The sectorial debate, yeah, a year about health. And so, I don't know. It's not a pay, and before better see, when you come about bedi, when I can be a woman, I was pomne, and seminar, so I crado, make sure pharmacist, one night a day, and branding habama a year juma, make sure a doctor for, a nurse for, midwife for, pharmacist. Woman, you know, abba, ye bedi, when you be something for questions, quite me afaswa, ye be improving your health sector. Meaning, the accuracy is that this is your sectorial debate live on Adom TV and Adom 106.3 FM. Also live on Facebook, Adom TV na fe Adom 106.3 FM. Ye twa nwa ba ye ba. Ye ntuma no ebeto aso.
We are still here at Accra Digital Center, and it's the second edition of a sectorial debate. Last 2 weeks, no, it was energy. This very week is on health. Apomodewon komo. Yeah, live on Adom 106.3 and then Adom TV as well. Baby, I'll show you no Facebook on Subehuyen live streaming. Middleman Hene Kwabnasa. So this is the time. EBD and Koma Edika Bonderu Ede Achero say as we count down to election 2024, very relevant. Say Ghana Nibiana Owo Kwanso Tuabano. Otia sie dientia oko Tuaba. And over probably for the first time, maybe in our elections and campaigning, major political parties, they resorted to explaining their points to us in terms of they want a bar on Ghana for. That's why your election headquarters, Kokromoti Power, you also say sector by sector, they need to tell us. It is our NDC ni Professor Bayu Ebejino Manemu any edin koma. What we expect of you is that bra munya kwenya ebetra so se NDC amanyu ku no mo ba ban mu no de mo ye apomde wonsem na fe ebra mo sa srese Ghana for betim ase se obafra banwa no 2025 7th of January no ede na mbetimi ayene sonko Ghana for betim ase. And then Dr. Nsiasare, representing the interests of the New Patriotic Party, they are in power. Itimuwa Bemusisiano, we are almost 8 years about the health sector. Again, Anamo Timiaye Ede Ama Ghana for. And more press, Bobe Breaki 8, no, again, Anna Mobetimiaye Ama Ghana for. These are all related to the health sector, so it's really going to be interesting. And the NDC, they will do their presentation, and that of the MPP afterwards. Your recognizable institutions, agencies, and associations were under the health sector. Our own Beji Brain almost a busa question. In due time, Mema Omunina Akwaba Nama Bobia Association and Ase Nipekuno Ubia one after the other. Again, most of you more text messages about Yabeji Bracken Kani in answer at the amount. For instance, the Ghana Medical Association, Omokrade, Omo Asante Mantema, a doctor for the donor Asia or Honum, now Omodi Ebobo for health financing. I'm sure it's going to be one of the conversations that we'll be having this morning. Very important. And Yashasian won't eat TV so. Now, OSHA, one of the bane, abaye financing in our health sector. And no agentua and motua. And clearly, if it's a carryover, what it tells us is that the Ghana Medical Association is worried with relations to matters about health financing. And then other issues in so raise here is in relation to sustainability in terms of NHIS, on board. And then they raise the issue of infrastructure. Infrastructure, very key, very important. And then they added up by saying that motivation is also key. Motivation, very key. The exodus of our health professionals is very worrying, and reasons for them going for, in quote, greener pastures, no, we need to look at that. But just like I told you, some of your text messages are about even before you pay you for no ebetenase na one of your presentation. No. Some few text messages, you know, you get us through Zoom soon. We are pregnant with a lot of questions. In fact, Momodo Dona also compare healthcare in the UK, in the US, in Canada, in Japan, in Norway, and other countries to that of Ghana. And to be said you see who Ghana, a health system, no, we'll have that conversation. Well, this tester is from Breman Brakwa, or say, I want to know from MPP how many nursing training students were enrolled in all health institutions 2017 to 2021 as compared to 2012 to 2016. Over your Poma, and we have a Breman Brakwa and our Diaba offer. I'm sure when we sit as in the political party representatives, no one be born no is our question. O question answer if free a brewery any brewery MPP amanyuko no nipa say na form free 2012 copy 2016 nipa say na this amanyuko no so far. And when so about say how do the NDC and MPP plan to address the current challenges in healthcare funding and infrastructure, especially in rural areas? What specific policies will they implement to improve the state of healthcare facilities across the country? I'm sure it's in line with the Ghana Medical Association. Also, Nyomani Bia Ono Ebo Bono. But unfortunately, they'll give an appropriate response to some of these messages. And that's one that says, what measures will both parties take to ensure equitable access to quality healthcare for all Ghanaians, regardless of their socio-economic status? Very important, very, very important question. You know, it doesn't matter. And Debbie, I shared this very worrying experience at Kolebu, where my sister, Yare, na omudine 2 benches. So, now, you know, me drew Kolebu na, you see, there is no bed. And I was in a nose mask. Me nose mask na a doctor for binim ni nurse for binim di medica. Oh my, I don't know one country. Oh my, I don't know one country. Within about 6 minutes, there was bed for my sister, and I've been sad from that day up to today. I'm asking myself, say, how many people will be privileged to have that name, Adom and Odiachemi? Say, oh my, Henintino, my sister. But for that name, that intervention, maybe. My sister Anka by now on Tiasi. But that is not how matters of health should be treated. It's very important. Inti Mr. AIM Shishia Kasia Pajina. It do a pomudi once my member said by a manual seminar because you might never know. I've ended up touching my holy family in an accident. Inti so serious a sector for all of us to take off our political lenses and discuss it appropriately. Because Techiman Mako grew to but nobody knows tomorrow. And then all of a sudden, bam, accident. Iti hono, obeye MPP and obeye NDC. You are going to a medical facility. Is that an appropriate place for you to be? So you can be a president if it's about health, or your professionals. That's why I say you know the needed interest. Nafi, yetimidisa and komowe. And this one says that what plans do you have to enhance the National Health Insurance Scheme to cover more diseases and make healthcare more affordable? In fact, I don't know, but it's like Dr. Salome Kai or say, NHIS can be consolidated. Ebasada ne titi and uti sika kono about pomudin for na akwe bibia or debia. There's an excuse. Your healthcare sika. Then healthcare debia na yes so far. So there's even a suggestion that there should be a special fund purposely for health. That's also being discussed, and that's another matter in Ediabe. And this one says, how does MPP and NDC plan to tackle the shortage of healthcare professionals, particularly in underserved regions? Yes, that's very true. Go to Mikrum Yensa, Kwabin. There's a big challenge in our villages. If you go to Kumau, maybe now, fortunate, because of governance being continuity, a certain particular administration brings a facility up and a certain administration also continues it. But it doesn't end there. You know, it doesn't end there. So those are some of the issues. Maybe we have a corner pano, na healthcare, you have absolutely no idea. But could also call a front planes a chiho baby. Na mekai ampeduso this matter of owoko car obia okuwo. I think I've forgotten Pandai. It was horrible. Ujina hono sada always in nipano o, you know, because a drone yedibema nipana timamana tias say drone. Even the fridge, yeah, tonam you say forgotten this technical word. Calibrated. In the say fridge in the bino ultimate function normal fridge munso the running na enye papa now she kuenia wa bre pana because of this unfortunate incident later we came to raise funds to ensure say your money in abetimi ayejima. So there's a lot of challenges in the healthcare facility. That's why I'll continue to plead say yenye very objective, yenye real to the situations. And this questioner says that what strategies will you implement to improve public health initiatives, including vaccination programs and preventive health care? Fantastic question. Very fantastic. Very, very important. But sometimes you're asking us, do we benefit from such situations where, you know, and sometimes to yes, who are players in the industry, you know, because we've had certain experiences, products are meant for a public space, you know. You know, bukata. So unfortunate. It's so sad. And again at Kolebu, you know, your receipt, you know, it's 50 cities, but you were paid 120 cities. And we've raised these issues countless on Ecosystem and on Bedroom. You go, you pay. It's Yajo 120, but on your receipt, it's 50 cities. Patrona 17 I can't or say anyawasem obaso bejapo mudionsem the kowenim, and they just intimidate you. You know, so it's very, very important as we talk about the association. I also share another experience. But you know, and the doctor was on phone. Or last week, a year or koi was I was sitting before him with Akwada Oyade. So it's a total overhaul that we have to look at. Bon coma and yet related to a year challenge. So it's so unfortunate. So some of these things keep happening in our facilities. This questioner says that how does the NDC plan to build on its previous healthcare policies to ensure continuous improvement and sustainability in the health sector? So specific question to the NDC say munya kwenya ba previous policies are now homamono and our health sector and you maybe ana kaibitim dia sustain. How do we or how do you guys improve on that sector? Very, very important. And also about. So finally, maybe 1-2 text messages, because at the tail end, I'll go through it again and read your text messages for you. This one says, can MPP highlight the key achievements of the current administration in the health sector? And how do they plan to build on these successes? So that's why these two distinguished men are here to do exactly what you are asking for. Mamenka also said, Yaton Safre, let me go through the list of Ayanipa Yaton Safre Mna Monswa Unyami Adom Omadikai Abekai and Sawan say. We have midwives, representatives, Ghana Registered Midwives Association. We have Gifty Mante, Patricia. We have Ahiazo, Aisha. We have if we are not Adom, we have Upon. We're expecting if they are here. Charlotte, and then we have Pearl Latte, and then we have Mrs. Linda A. Agblo, Director Mana, Director Mana Mission Health Service. We have Mr. Gabriel Ni Utu Ankara, Mercedes Health Trust Accra, Dr. Kwesi Udru Apia, Hope Christian Hospital, Fete, Mr. Kweku Frimpong, Health Director, Savior Church Health Service, Doris Aban, Vivian Kumoji, Letitia Atia, Justina Dugan, Dr. Leila Al-Hassan, Medical Director, Urban Aid Clinic, Accra, and then the Chairman, Community Practice Pharmacists Association, CPPA, Accra, the Executive Secretary, Pharmaceutical Manufacturers Association of Ghana, PMAC, the Executive Secretary, Pharmaceutical Importers and Wholesalers Association, PIWA, the President, Pharmaceutical Society of Ghana, Accra, the President, Small Scale Pharmaceutical Manufacturers Association of Ghana, and then the General Secretary, Private Health Facilities Association, Ghana, Accra. We also have the Chief Executive Officer, Federation of Africa Medical Equipment, Disposable and Devices Manufacturers and Suppliers, Accra. And we have Alfred Believe Ahiache, National Organizer, Jerry, National President, Philomena Goze, National Vice, Gloria, National Women Organizer, and Isaac Boyson, National PRO. These are National Policies Crusaders Association of Ghana. These are the group of people but the Anope Yense Christian Health Association of Ghana, Kweku Frimpong, Director, Mana Mission City. Pamcho, Kweku Frimpong, we want to see you by hand. Thank you. Thank you so much. Thank you so much for your time. Thank you so much. And Director, Mana Mission Hospital, if you happen to be, we are proud. Thank you so much. Dr. Kusia Piodru. Doc, if you're here. Doc, thank you for your time. And then National Policies Crusaders Association of Ghana, Benjamin, Jerry, and is it Anana? If you're here, please, thank you, my brother. Alfred, Believe Ahiache. Alfred is here. Oh, Alfred, thank you. Amma Gloria, is it Asma? Okay, Amma, thank you for your time. Isaac Boyson, Isaac, if you're here, thank you. Isaac, show by hand. Isaac, okay. So Ghana Registered Midwives Association, Gifty, Mante, Gifty, thank you, Mom, thank you so much. Aisha Opon is also, okay, good. And then we have the Private Health Facilities Association of Ghana, Frank Toblu, Richard, the General Secretary. Uncle Frank, okay, thank you so much. And then we have Francis Azuma also here. Francis Azuma, if you're here, we are grateful. So as and when the names comes up, we'll just drop the names for you. But it's to tell you that we are set for the sectorial debate. But maybe you've just joined us. We are live on Adom 106.3 and on TV, Adom TV, Badwam to be precise. This is a debate that every 2 weeks, it's a sectorial debate, relevance, essence, and it's a no sector by sector what various governments keep doing. These two major political parties, MPP, NDC, and then get to know those who want to cross the 8 and those who want to come to power, what they intend to give to us when it's about the health sector. All in essence is this: your power, Kokromuti, and into the multimedia say your election headquarters, Kokromuti power. Kwaba, our guests are ready. They will be walking us through their presentation. Afterwards, these various associations and agencies will be asking questions, and they will be picking your text messages as well. Itimidi Ebro on Madika Kacho say, and paying for Bibri Atanasi Ewan say, I'll go through the list once again, and then if we are not just a medime in paying for di na year to a jumedeso. All over again, Christian Health Association of Ghana, Kweku Frimpong, Director, Mana Mission Hospital, Dr. Kwesi Apia Odru, they are all here. National Policies Crusaders Association of Ghana, Benjamin, Jerry, Anana Soa, Alfred, Believe Ahiache, Anafi, Amma Gloria, Asman Soa, I'm saying, Isaac Boyson Soa, Ghana Registered Midwives Association, Gifty Mante, and Aisha Opong, Pharmaceutical Society of Ghana, we have Reginald Brown, and Grace Nelson Amanso, and then we have Community Health Nurses Association, Esther Bampo President, and also Pharmaceutical Society of Ghana, Reverend Dr. Denisena Awiti, Executive Secretary, Christian Health Association of Ghana, Dr. James Diansua, Ghana Registered Midwives Association, Pearl Latte, and Comfort Entry, Hope Christian Hospital, also what I'm saying. And then we have Ghana Registered Midwives Association, Charlotte Adobo, Patricia Ahiazo, and then This one I can't really see well. So but I'm seeing, is it Emmanuel? Which one is okay, so Emmanuela Tribi. Okay, thank you so much. Because indeed they're very important. And this one says Muzdasiru Pamcho. Who is okay, Chief, just call out your name. Assalamu alaikum. Good. Is what? Okay, Mudassiru Mohammed. Okay, I got it right. Thank you so much. We are ready now to introduce our special guest today. Na Iweya and Makacho Omo walk you through their presentation. Na Omo Eko Omonim Dombe. Well, Professor Titus K. Bayu, or a parliamentary candidate for Lambusi, a medical practitioner, an entrepreneur, and a health advocate. Professor Titus K. Bayu, Pacho Yadasi P. for your time. Thank you so much. Yes. And then we'll get to Dr. Anthony Insia Asari, who spent 40 years of his life in the health sector. 40 years of his life in the health sector. In fact, he's a health management expert, and he's worked in the health industry here for close to 40 years. Dr. Nsiasa also, he's created a balance of strategic, operational, business, clinical, and health systems reform. So many areas are of finding a doc. Yadasi P. Short notice and no brown so ode amam. Somebody just to let you know, there's a sectorial debate in Kuntebufi. Political parties now makanyina no most more brebeso, but these are the major political parties, MPP, NDC. Say 2025, yes, so it is either His Excellency Dr. Mahmoud Baumia or His Excellency, our former president, now flag bearer of the NDC, John Dramani Mahama. That's why Wako here say omo person mo break 8, so omo person mo ba bemudia. These two major political parties, and you mefa apomudin wonsem no, so mo twan for yini editre. Aha, ye me tutu, ye me konto kwa ha, ye me kankasa ense na emfata. It's very important, and we share the space that we all have in terms of the media space. What most of us are resorting to, then we resort to attendee. Very, very offensive and unproductive. And on platforms of multimedia, we have never, and I don't think we will encourage those things. Wow, Habiano, that's it. Ebrebeba ma onso watime busa question. Na ubusa question, Mr. Ubusan Ebu any idiom, but forcibly put your case across without left or right. Forcibly put your case across na mpanyinfo na so intimate na omo so intimate pay attention na omo respond to emfa emai de tie so ni eku ahodo amabanyina yedamase but obia prepare kosa mienu cause of a brainty eku ahodo amabanyina because me say me hwe bi ni mo ba na me hwe books na udi agwa na ye de beje ku ba kope midwives for nko ansem kwa betimi am ya pon program be 9:55 p.m. I tell you. It will midwife now because all call health schemes out on the original young could beam. It is packed with a lot of questions. Into your brain until it could be a minute a question me no nan paying for it imagine bre at the amount now no kama. So I do bra and paying for Ebekasa, Hoa say they Dr. Bayu Agina. The National Democratic Congress anemu na nyoma fa apomuden ho omoniswade hu no onanti emu through the presentation no na for we are Dr. Nsiasa so edne dia to aso ntie mo sem ebra obey
na pay na michia amanfo ya behia mo ha na pay me say meda Adom FM for ase Adom TV any multimedia for the opportunity say meba minimum bedin komo kakra afa yempomuden ho asem na mejina yem party National Democratic Congress anamu anapai na mache mo nyama kakra yaye eni adwempa ye wo ema oman no efa yempomuden ho na mekasa mejina mu ama yen representative ana ranking member ewo health committee honorable Minta Akando uncle no was obaha na wentimi na mabesi na nti preparation America no enema meka no na adwen wo mu bi na ye party no so ehun nsem ewo mu kakra na ye kasa no mekasa na pay ma chair ne say the health sector mpomodin adekro nti a ewo say yes sesemu na yentimi enfancy p to reset the agenda. We are asking Ghana say yen system now we should reset the nation onto the path of prosperity and shared growth. And I'm going to tackle the health sector. May I disclaimer kakra subium any saying your party manifesto nan kasan ye babe launch yen nitino. I won't go into the details of the manifesto. Me do maybe a mema policy positions kakra ye man penny and I yen franca ni nipa okra yen franca no edi atuja. And then they treat me into me from one of the achemi into me patch or next slide. And me say me don't be far overview muka cry human resource system, health systems, NHIS, and in Yamaka Krebia, mecheche, and Yama see abako semwa aba na yadi no Krebia tuja. Na beti me ama amanfo multi ye mu hwe ye fifie motimi form me an informed decision about political parties mienu amanyo parties mienu we motimi choose emu baako. Next slide. Entino me pacho oba impomodin asemo a enyema NDC aye ewo impomodin asem no edorso na me dikan efi infrastructure na the current time me pese make infrastructure no and say yetia the biggest intervention aban we aye be omoye ehun dede agenda 111 into one ka wa asema sometimes obi fi say wonye hwe nti me twi madwen akọ nyama kakra yaye na moehu ye mampanyin dada His Excellency John Dramani Mahama SNP say or the 6,000 hospital beds eba beka the healthcare system emra na owoso now one can anye a slogan say 6,000 beds ana bibi ameya ne hu dede say the yeti no na emum ordinary bi etoto akwan mu say the be ya obetimi ayesa ebi ni saying yenina in University of Ghana Medical Center or started here the target was 617 beds Tamale Teaching Hospital to break down nyina wa ha hospitals wa mabobolo bebre na wi em say nansenya omokobie sewa de no Upper West Regional Hospital 160 beds we nyina okeka bomu a obe any bia me be ka ho be say would have achieved that target of over 6,000 beds and anke pese ye de ka ho. Next slide. In all no NDC aban during His Excellency John Dramani Mahama time yamfa slogan bia ntoso yamfa din bia ntoso and sometimes yankofo enhu ni ye na pese mu na moti ase. In all hospitals and polyclinics we see about 59 ne bia kakakra bi obewie ene ejama abam amambo de yetwaso oja eye won susu ye se onua ba obetwaso bebi a yensika akwhye no ewo se oma ban aban ska omotwaso ye 69 hospitals and polyclinics. Health centers ye 18 time ye ka say ye appointees obi an sacrifice a percentage of the salary na yen fan ye chiefs compounds kofo bisa say ahini aye out of about 2,600 and something chiefs zones no ye constructed 1,260 chiefs compounds completed and another 1,600 were at various stages of completion. Emra na ye efim na me bisa anapay say agenda 111 ayati hu de bre sa no and na ye kase ahi ene ye wie me uncle etiha me very senior colleague our professional mu wa ha ebia oba obekire enunumu but sometimes no the way I present ade no ebema dina koso bebre but one pese mu a you can bro for me say the devil is in the details ukomu a ena hu emunsem but one ka won so asem a obi hu ne waye enti niam ayetimi aye no ebi ni in terms of health infrastructure na hospitals ne de enye ade a ehinta obi patch next slide. Yeah, so in 5 years His Excellency John Dramani Mahama. But my quick example, Ben Yenina, Dodoa Hospital. It's a model hospital from School of Public Health. A hifa nina ye bibia near a model hospital and can ha a honey do in Kofoko. It was started and completed within 5 years. All right. Now 7.5 years, 7.5 years. A buying way a was no. Any sika o manye nyina so mbetimi ambo hospital baako a o ma hyase a o ma wie in 7.5 years ebe me de say ye betisa hospital no pache next one. Now ye ba other intervention ye bibi on National Medical Equipment Replacement Program. Ye this US 264 million shemu na ema yen hospitals be bree starting your equipment or the ejuma MRI, CT scan, fluoroscopy, mimi ejuma okolebu, MRI, when a DB buy, digital mammography, oxygen plant, ambulances, rehabilitation of theaters, kolebu your child health theater now close it down for more than 8 years. Ne ejuma. This fundy and they say child health theater. Say a ejuma ye nkofo operation or uremwa say yes. Wako UGMC pen the same style of finish. Ejuma. Entino enyema ni bia ya ye no ewo sa infrastructure no. Patch next slide. Enti yako human resource situation. Yako human resource na. Meka ni say NDC abaya akonimu. Ena yetimi negotiate ye assigning for the first time conditions of service for medical doctors in Ghana. And there was no codified conditions of service. Me, some men and your GMA executives strike was a koyakobi. Ye did there was a yenina, but I bind to me signing conditions of service. Conditions of service for me basis for other cadre of healthcare workers, union leaders, I know when near meetings, yenina, choboy, nurses were her, pharmacists were her, gospel for her. Your condition of service, Dr. Ford DNO was the first, and formed the basis for others to be able to complete. And this is one of the single intervention etimidi ajubro aba labor front our health sector no. Because any conditions of service no, obi sorry I say to me fuel so na dani asem. Obi say me transfer allowance na dani asem. To say the nyina be good document no. Aye the time atoso. Into woko sign time no so ya untimi san ko say to market yam ye ne say into beti say gidigidi bia ba na ya de foforo na mum enye conditions of service ho asem na say ya obehu na oko education sector ebinumu person omuso cause strike ebinu kwa was strike because of conditions of service, but under the NDC government and yetiminya the first ever codified conditions of service document signed in this country. And because of that and other interventions, it means so a reduce brain drain. And I'll credit the previous MPP government under His Excellency John Ejekum Kufuor, our boy with a postgraduate medical college, and Ghana College. That single intervention stemmed the brain drain among medical doctors, because at that time, that brain drain, people were leaving because of two main things. Say, the sick and now say new skills, specialization account. Because now West Africa program no pen, with 20 years don't read that. And Kenua, Medina ha my consultant and Kebia, but Mimi, I went through that college and then went through the West African College. I have both qualifications as fellow. But that intervention, and I might be yet na Ghana. Because answer never do me so no, Nankophobia or her, or maybe medical school no. Best student, Unyan crown out the award, amano. Mimi medical school first, the best student that graduated from UGMS that year. Your boy didn't know Ghana. Our Babajin award. No. And at that time, Omuvi school no moko because Omoko specialized. When that intervention came in, it stemmed the tide because nothing comfort me training. Spiraling from that, the nursing college, the pharmacy college, and all of that has helped specialized training. But I'm saying that in addition to these conditions of service document and other things, stemmed the tide in the brain drain. Unfortunately, in Mpensenpensenmu brain drain no, a man honso sebi sin kaneno, and as a siano assistant, and society saying. First, young doctors, young nurses now moko because omoko pay extra skills. sesia no nkofo ekono specialists minim specialists consultants obi a we specialization or critical care nurse specialists or omunina at some point some hospital systems not multi function because the ICUs in some places were struggling to function because omu trained specialist nurses in echo. And the reason is this: one, second is that there's a state of hopelessness, despondency. Obi adwin ho a doctor ba ko oka chair me say ko ugusu tigana ho me say ade o si hwe me eda me hu say me teacher a wo kire me ade wo medical school akogina finance ministry pacho say o mo fa ne pension se kama no no ntimi nto eduro no sada na me hu say Ghana no enye yie bio na me ka say nyame ma ya botre Ghana be say yie will reset the country. And you know, these two factors have caused this brain drain to go up again. And the factors are not the same as before. The common factor is the economy, but there is currently a state of hopelessness, despair, because for sure when you are next slide. So yenko human resources. Oba the human resource situation, as I was talking about the doctors and all of that, nurses and so but then NHIS aban we nurses no so be eko. Fine, apart from the general conditions na enye no. Oba training na. Omo in fact MPP aban ma wade ene wonsa lefter and righter. She say left and then omo de beji. Because omo ka say nursing training allowance, omo restore ometua ye boyensam ma. Then at the back and omo pay admission to the nursing school. So what's your letters? And I'll show you some of the letters. So some of the training institutions say, won't me admit more than a certain number. Some of them were taking 50%, 70% off the total number of me admitting. That meant that the total number of trainees and people coming out now is going down. So we have a situation at AB equal and we are training less. Then what happens? Allowances no so and to me arm. But your next slide. So prior to say Akufo-Addo ebeba abeye yeman penyino between 2012 and 2016 yeah buying added 66 new health training institutions. 66 my bobo bibi din wa ha a big back question tana mo per more details metimi ama yeah upgraded Kolebu, Konfanoche, Cape Coast, Koforidua Secondary Burger into model schools the rest were supposed to learn from. Now the nursing form at the time 100 cities say 200 cities and above or minimum, but all these things are affecting the training of nurses. No allowance no so nti amwa kape no eno so a muntua ye nyina yete question na obi ko bisa your man penyin your vice president penyin abedi akire emra o call ni to baby about this nation allowance. Any response or my the following week yete say ya tua bi omoni gi omoko social media ko kasa kakra e ba ya bebre nan so ensan kan on there. Next slide. So since 2017 till now, no, various nursing training schools, no, and and they've reduced their capacity. And I've given some example. Ugo Laura currently operating about 30% of the capacity of the facility. And Emma, the total average admission of nurses at Nigeria school a swab form. And to make things worse, you are reserving letter principals the reserving 30% quota for the Ministry of Health. Say and will be apply for nursing school. No, they call minister or they call MP or Boami because your name says 30%. No, a honey defa and I defa here. Your name. Patch into us. Next slide. Next slide. Yeah, and Timpacho letter no and a dasui. This was a letter written to a principal. I am Pese Bema Nidin Abba, but the school no. Omoka chair ne say registered general nursing admission quota obetimi afa 50 70% for institutional onfa 35 na 30% no for the ministry 15 of that 50 no ministry na dey call for ne beba oko nurse assistant 100 obetimi afa 70% that's 70 people another 30% no on jama sakota no ema ministry so it's nursing schools e waha about 66 nyina eja 30% ama ministry a na sa ministry no mo dey fa hwan so na ama sa admission no akọ we ni mu na ma nkofo ma politicians a lot of pressure who call nursing allowance na me the details na to but I won't go into much into it allowance no ne botaye ne se omo wo school no omo dey allowance ne be hwe omo ho wo school no ebi ni mu ti wie school na omo nsan kan omo allowance ne ntina ye dey and while the fees is going up over 3,000 allowance ne there ejina it has only doubled from 384 to about 600 but look at the jump in fees from 700 and something to over 3,000 and these groups of nurses sanka or more allowances ne but you next slide nti mo ye in central for ahu sa pictures we nyina of nurses demanding rotational allowance ebinu timi we rotation no na allowance no so my we nye school there no o ye rotation na o fa ka ko ejuma de bia I was say etima obibi no eno nso my patcho ye nto aso next one so recruitment no oba nursing recruitment a metimi aka say eba ha I can predict ebi kwa na metimi ayo also prophet ewa ha say between now and election yabenya this type of love letter biom because 2020 ACE ebesan biom ye ka say nei nurses omo graduating from 2020 graduating batch 2021 2022 obi ayemfa o mejuman all the cadres but enche because election is getting close ye letter beba say ya ma financial clearance for obia ye fa obia wia ni catch you say and starting from 2025 because by that time no say John Mahama neighbor o say why no oba come and inherit that trouble but you hear me voting no ya more clearance na say where we school 2020 now when your clearance na say 2024 akaka kra na ato aba na more clearance na say osubo we same now with that say now do nursing training o do nursing skills akoye catering akoye hairdressing akoye juma bebre wo fie because we need juma na say we ba na say nunti obebo age so age aban no so ato ama no bioma na ka say wunua no mo du echi no omo so clearance be ba na 2028 pache enko so enu ena matcha say no oko staff establishment na because of the reduction that high attrition no there's evidence to support that the total number of workforce in our health sector no, is dwindling by the day. And also because yen recruiting krofo tifie a yen fa omejuma e bi ko yen fa bi nshem in the total establishment increase the health sector in 2021 no na wo 251,000 then it started decrease here 2022 about 208 then it came down to 182,000. The population is increasing. Nipa no air doors wo man no mu. Nkofo bebre e wese omu wie school no. We need to increase the health worker to population ratio no. Na nipa do na eso 80. Bacho yanko next slide. And one of the reasons I make say the economy in Intina nkofo na economy metro ha. We pay slip, actual pay slip. But let's go to the next slide. Na me mamu details no. So if you look at the medical officer salary as of 2016 no medical officer na the salary be 3,623 2024 the salary almost 10,690 obeka so abanya ya there but take it into dollar terms we say the salary no is what because at that time it was worth $953 this year about down to less than about $713. And it also affects the purchasing power. At the obetimi this can atono. And also our form. At that time, na cement 27 cedis. Into unya 3,000 now. You can buy 100 bags of cement and still have some money. Edia ye we juma bi. Say sia unya that amount now. 100 bags of cement also can enso because a bag is over 108 now 110, 112 in some places. That should just tell you. At the Kruntia Otimwa, you may feel hopeless and want to move. Next slide. Into a bian macho how with a nurse, and so a similar comparison. You see that in dollar terms, the salary are dropping from 307 to 214. Next slide. And also to their purchasing power. The staff strength now, this detail will show it, but we'll go on because I don't have more time. So, my question, Anna Asembisa Bako, me wo, Emma, me my mumpenny for, I buy mumpenny for, and say, Agenda 111, Human Resource Plan, because there was high attrition of specialized nurses and doctors, experienced staff there was poor motivation. We have unequal distribution of the existing health workers. Oko Lambuse, Miami constituency, your doctors too. This September, Bako by school. All by school, Nakawan. But they see Agenda 111 and it's supposed to come with all the specialist facilities. What is the plan? I equip these facilities. No? Now, is it possible, say, I buy him say, Bia, I didn't cry shots, and ya do baby, into one on down dream, said Obeya, or page my form by age mom, because Ubi build the net jana, unage my four, next soon for so a day. Now, Oko compare it with His Excellency John Dramani Mahama time. Time I year see UGMC. Eya ba ne wie yenu, you say UGMC here, specialized doctors to work there. It's supposed to be quaternary services into our mobile kolebu ebe yi doctors edwom call Israel eco training for the various departments. They took various categories of healthcare workers ahead of the completion. Say anke wie ya ne edwom abehim eye obi a ordwin say me ya do me pese ye adwuma yie ene be yesa ade. Then next one. Next slide. Into health systems and service delivery. Quick one. Hano meka bibi baako pe afa ho because sometimes ebia na ye refi niema kakra ana yenka yente bi nkai ye mampenyi abediechire His Excellency Dr. Mahmoud Bawumia is claiming the digital tax here say is the one championing all digitalization me pese me twimo adwen ba niema bibi so kakra ma mu hu say in terms of ICT and digitalization in health and other sectors no. The foundation was laid and Roberto. Give credit to whom credit is due. I've given credit here to His Excellency John Ejekum Kufuor for Ghana College of Medicine, of Physicians and Surgeons. Yesterday, e-health, way before, piloted it, and there are evidence to that. But your next slide. In fact, I've quoted copiously parliamentary proceedings. I later met me obiahu. But the interesting thing is that the health management system it is going across the whole country. His Excellency Dr. Mahmoud Bawumia is trying to claim say it's an innovation, it's something of the urban. It was first brought by the NDC government. Anybody who is a health worker here know about the LIMS. LIMS was piloted under NDC. We had a rollout plan to make sure say we can move all our hard copy data onto it, create a backbone. Even private hospitals can refer into this system. But yanya sa niako sini say yanya situation the rollout is quick, not well thought through. Say LIMS no jana fakon is going through all the public system, but the private system no, you cannot refer directly from any other health system into the LIMS. But next one. Mr. Mimre Eko, and when now your speakers are etwaso from Parliament, just to show some of it. Say this was actually done. It was piloted to go live in 11 departments in Kolebu at the Zebla District Hospital, and these are all facts in Parliament. Next. Next one, quick. Next. So His Excellency claimed the digitalization tag. First was an economic messiah, now digitalization. We are not sure where we are going next. Whether it's it looks like what is trending now is mobile phone. I don't know. And we are converting from national debt to personal debt. Because they say, na yankasa yedika. Because you phone nedika over 800 years. Now, then to us. So when we go to the Ghana Health Partnerships, I just wanted to explain something briefly. Mote say na contain the bresuwa na yentimin clear. We're running out of medications and all of that. The explanation is all given here. Ghana has partnership with several agencies. Gavi is one, Global Fund is one. This one was in particular with Global Fund. I co-funding. And she said, you are fully for 3 of the vaccines. Now can be a co-financing mechanism. On Beji Nyamana Brain, then we'll pay and then clear them and then use. The part that we are supposed to pay and clear, no, and the money in Abedaho. It resulted in us rolling back gains we have made. Our country was trumpeted as the best in immunization coverage. We went down to about 60% in some diseases, like measles. Next slide. Next slide. And at some point, the Kaka Global Fund, and Yeno Munyon Kofano, and Komu Yachi, Aseno. Yanko next one. So next, all these are details. So NHIS, na me baby, me say me time no eko. Me patcho me pese me can create back ko pe echere wa ha. NHIS no. Obi ka kire mo say sometimes me think of obisa NDC for mo chair social intervention back on my NHIS dey dey buy. That is a factual lie. Me sinipi say it's a lie. The NHIS first didn't start as NHIS. The concept of NHIS started under His Excellency Jerry John Rawlings. He planned it and then decided to pilot it in some places. Or piloting, you know, the Medical Association was in support. At some point, they were criticizing some of the modules and then rolling it out. When we wanted to roll out a national health insurance scheme, one of the most vociferous critics, Honorable Dr. Kwame Adokufo. He's a past president of our association, a fellow, a very respected gentleman. But that was the view he held at the time, and I have records of it in parliamentary records. He said that rolling out as a national scheme is not possible. Here Ghana for the scheme will not be sustainable. So they should go in for district, company-based, private mutual schemes. This was what the MPP proposed when the NDC wanted a national scheme. True to their word, but we still set up a secretariat and piloted it. But almost by, you know, then they passed the NHIS Act. That's the Act 650. And this is one of them. Government must accept useful minority opinion. This was one of his criticisms. He criticizes that the scheme is not sustainable. Next slide. Almost by, they passed the Act 650.
Okay, and so Professor, Brenington, you need to wrap up for us.
Wrap up. 1 minute.
Yeah.
The act they actually used to set up the NHIS, no? I said we should have district mutual health scheme, private mutual health insurance scheme, and commercial ones. Nothing like a national scheme. But the act was called a National Health Insurance Act. And no, and I'm going to say MOD did this, MOD did NHIS. But the next one is that we repealed this act and made it a national scheme. And no cry that one. They put it in law, but at that time they made it old crowd scheme or lambusa. The next one, quick. Yes,
Professor Bayo, remember audience here because there are a lot of questions for you and your party. And to be sure, say those questions will come up.
The last sentence, I mean, you got nothing to say.
Yes.
NHIS, the last me can.
Yeah.
Bonnie Bakwa, me fee say. A bind way a dia Ghana for. The capping of the NHIL.
Capping.
The capping of the NHIL. But a kwamba na se me babe here no, I'll give you the policy statement that we have on health because unfortunately mentimi and do
Thank you so much, Professor Miubajo Bosem Gakramano. The party and the Prof CPE. He's talked about infrastructure, he's talked about interventions, he's also talked about human resource and so many others. Be sure it's a question time now. There are a lot of things now. It's time for the new patriotic party, ably represented by Dr. Nsiasare. So, Debre, Bonsem Ebra, Professor Kotsas, Dr. Nsiasare, so Eba.
Meda munyina ase meda multimedia ase se odi abaha no na me say health dey na nkanya politics but me hu say me wo fa ase no odi afa ti me go straight this disclaimer me yen say parliamentary presidential candidate Ewura His Excellency Dr. Badwam ebe launch a policy document no mubu ha eni mu ahia eni makasa eni wo mo en share so nyina ba bekasa enti meko street maka eni ma
ye buy for the past 7 years 7 months no yetimi e de agugu akwamu na wo hwe apomudina ewo nema pia de ba ema ya apomudina first ni pa be ye adwuma de toso mienu ba bia be ye adwuma no de toso miensa akade a de be ye adwuma no ena de toso nan eye se wo be ma omo dipa amane nyina obi atimi anya apomudina pa a ye frɛ no e kano SDG omsi universal health coverage na me de yibe ka ho quality aka ho apomudini papa ti enkoso ti me kire mo ye baaye no since 2017 ene ma ye next slide please obahwa ye baaye no ye beto projects bi a ye be fire Eurojet projects me hu se bi nu me wo fa asere kasa no o kan ye siwe bi se question bu sa no say be kwa hospital da be na ewie wa hospital da be na ewie Eurojet project ye wura kofo na he ase me na me kam obi ate ase April 2008 eno ko hunu Eurojet indexer a o free Egypt eno no mo hihye eye 7 hospitals for Ghana for Ministry of Health and then 1 hospital echo military na first nkai ye no opposite Prempeh College na me ka committee no na me konfo anochi ena akire NDC force ka so mba ombe military hospital Tamale ena omu yi call Tamale omu win ye no omu san yi call eba 37 ombe foundation na ho se Kumasi asase ne ena ko kire omu asase wo aferi parliamentary select committee wo health edi o si ho no omu ko aferi tina aferi de no ho no ye wo wa hospital regional hospital Asante regional hospital was area and it was 6 district hospitals enti obahwa ahiase pa that time but also ye umunya parliamentary approval 2008 enya cabinet approval ko parliament enti obakire se bia de okofa scan ba ye and o see ye na say de obeto ye a emfie nwotwe wo fa pesika ma se fasi dan oba da no awansi afi we no besi da no awse da no kora ne nyina ya media ti yenkoso ti Eurojet no eto na ye 9 states out of fully 1310 Intiga East first one we August 2019 160 bed ewo abawe ne buy no be complete ye inti wo be kaya yewura president Kufuado air commission no o see you sa project afa abai mako enam e kire se Ghana ha no yeti amamuo ase ti yewura president Kufuoso late professor Atamelso yewura Mahama so ena wono abaye president eno abi ena November 2019 yebie guys Kwabenya ena de won sokote no so yebie no November 2021 next slide please tepa and so October 2021 chufupra so November 2021 ena kono ngodumase June 2022 next slide please Salaga still not completed near 68% oko Seria is completed ye light they call rules no make us ye be commission say we are within the next few weeks and at the military hospital so by this year so by I'm sure I check October be commission say we are so into here ni na no they are claiming say ni na yo modia but the MPJ say sa hospital ni na no during the 8 years of NDC na one bed the currency baby me boa na obi anya adwuma any one of them oko or see CNC hospital bia these are hospitals which are started ya completing you know for example me can make a contractor in the contractor controls zone Italian oko tete kwashia ye rehabilitation for more 50 beds they ka ho oko Chebi hospitals wa and between 30th and November yewura minister Adwam commission okwatibia the same thing next slide please okoso asese no ye hospital so Obuasi trauma center 55% Obuasi o kutwa Kumasi a wohwe enyinem hospital ho no so obu si yesi da no ho akakra na ewie be wie ne disi anya commission ukọ nyire si so a enso ebi wo ho monko na slide ukọ formana ukọ Ashanti region meka Ashanti region the only 2 hospitals are sa NDC government here asia omontimi anwie ebe wie nansen a yakopa hontuma wo mu ye adwuma ho mu sesi a formana 120 bed kumawu 120 bed ebi de ma wo mu ene dodowa ana wo mu ye na ye hospital projects and so no ba ko pe eno mu wie me bom se mo wo ko dodo wa hospital kan kama de aka ni na wo ntimi anwie obi sa so mu disika de ye den o mo anim sika de o mu de ye o mu bi ko ye research ni ma so mo so ba we ni election ti ye ba ye no na aka sika no 38.8 million ene ye busa contract de hina obetim de awie na wo se formana kumawu na secondary accommodation nyame ncha de ni nyina ye apensa ya payensa fro nti de me kire nyina ne se ye beto ade a ye beto ade a ye nya no ho ti se Eurojet projects a o ye ba no ma kofo ko pay scan go ho a o mo ntimi anye ba kokora anwie ina o mu fra ba mu a ye ba ye be wie ni nyina ye wie aka salaga ene aferi a pesi ye wie monko so biem next slide bekwa wasi bekwa mehunso de bekwa here you know bekwa when we came bekwa near painting ho and ewo burubu ewo green bookum ba bekwa hospital was not completed se bia bekwa foti ombeka se no kore ye ba ne ko pace kaka ho ene ye na contractor ewie ya ye commission bekwa November 2020 oko Legon hospital de bia omude bom ho samarmane efe University of Ghana Medical Center there was phase 1 and phase 2. This government finished the phase 2 and then on 24th of December 2021 a commission the COVID by the year nyina no baby a na intensive care unit maybe a unit mi we oba okowura ho a oduru da na opposite baby a stimulation room no a me amekọ ho during the COVID period no na bibia ni inside lift kurane bi ni ho steps kurane enyinwe ye ba ye wie ya COVID ko ye no na continue ye wie ohwe kolebu any confoanoche nuclear and expansion of radiotherapy and nuclear military also ye wie no April 2020 continue Okobolega Tanga Hospital I say 1995 na motamale I go through phase 1 phase 2 phase 3 phase 3 no 295 I say ye wie pese ko na commission confoanoche maternity and children's block and obi anim history na ewo ho no a champion time 1974 say yeguso a contractor as you speak no debt research no ko wasamba wo ye ho adwuma 500 bed and so yeguso e pese wie Kofodua hospital new regional hospital and so 285 is ongoing a contractor about site or research omo yankoso other projects was Shama and no ye project be a suspended because of the debt restructuring. Okola baby na omukusun ho nyina so as we speak now governor Pesca contractor no site or ye next slide. And a construction of Temagina Hospital and medical source so igusua ye ho adwuma at Temagina Hospital about 17% ya kan so omugusua omoye say center medical source almost completed. Next slide please. If you kwanta oko sisi ya kasa ya edwuma gusu dendendin a ye pese ye refurbish na ye re-equip efie kwanta hospital. There's a new hospital a regional hospital and so what Agoran Kwanta area so omoye ho adwuma about 27% the same contractor. Oko Kolebu rehabilitation diabetes and a center and so ye ongoing about 80%. Sane men nyina free April 2024. Into which is a baby contractor na ye adwuma they are more than 81%. Next slide please. Next slide. And COVID by who said you need treatment center. Okay, say corridor by some time ago. Now there was a problem. I say a makeshift. This government has put up 17 isolation centers, any treatment centers. For example, Kolebu DSA ye oko Seria DSO ye oko the walk Kumasi South Hospital and so ye ebi wa Dakulu. Next slide. Ebi wo Zibila, ebi wo Dodowa, ebi wɔ Pantine. Next slide, please. We are preparing ourselves in case there's any other emergency. Ebi nye maybe eden kɔfo bɛkɔ. Next slide. Asanwere soso bi wɔ hɔ a ya complete. Wokɔ Kolebu Kolebu so omo ye sa fevers unit. Enso say is completed. Wokɔ Takoradi so a enso bi wɔ hɔ so ya complete. Next slide. Na ebi wɔ Naregu, ebi wɔ Sunyane, ebi wɔ Kumasi South, as I said, which has been completed. Next slide. Ebi wɔ Aflao, ebi wɔ Ilubo, ebi wɔ Ketu. Next slide. Ebi wɔ Kofoldua, ebi wɔ Dodowa, ebi wɔ Nkinkensu, ewo Ashanti region. Ena efie Nkwanta so ye bi wɔ hɔ a so ye ongoing, ebi wɔ Pantine, ebi wɔ Weja. The whole idea ne say, ena ebi so once wom. Che say ebenya throughout the country, ebenya baby a say if there's any issue, then ye den nkɔfo bɛkɔ na yɛtumi isolate wɔm na yɛtiti wɔm. Me wɔfa asɛn kasa wɔ se yɛnkyerɛ hospital yɛ baa ya yɛsi. Ɛm sɛ bia ya na ɔmu wiri fi kakra. Yɛ wɔ bibi ɛfɛ environment project. Ofa Mochiri road hɔ a behind the NTC. So wɔn sɛ hospital ka banka bɛsi hɔ. Yɛ wie urology and nephrology center. Yɛ de bɛhyɛ aseɛ na yɛtumi de treat all the chronic renal failure cases and then make it a medical tourist center. Okwa environment projects ebi wɔ Swami, Twɛdeɛ fences, Sabronum, Dorbonso, Manson, Kwantaniade, ne nyinaa gu so a this year is about 90. In fact, the American nyinaa is about the Eastern region, Ashanti region, and baako so Pon, Kantamanso, Edukrom, Kwaben, Achiase, Yuamapo. Ne nyinaa yɛ 40 beds. Omo ye buy no mo ye environment projects bi ewo Central region and Greater Accra region. It was 15 beds and 30 beds. And only ye buy and ye see a be improve near 40 beds for where the population is not big. Enti obika say ye nye hospital bi ana M1. All these environment projects Kolebu dey say we from April 2024 is completed. Our president Kwako commission in the next few weeks. A person who didn't go any hospital go for because we want to commission things when people are working there. Next slide, please. Yebaye, not you know you no. For example, there were Eastern region, any Greater Accra region, 10 in Eastern region, 5 in Greater Accra region. We came and then completed them, and then started this one. These are the pictures of urology and nephrology center. These are the pictures. Next slide, please. Then these are the pictures of the 40-bed hospitals. We are constructing about 29 of them across the country. Eastern region, Ashanti region, Greater Accra region. We were at Tiwadieni, we were Sabronu, at Tiwadieni Wakwabin. Next slide, please. And then these are the equipment which will go inside beds in Bibia. Next slide, please. Then I'll come to the great agenda 111. And umutia na umuyamshishi umuno. And so can we say agenda 111 in your human resources plan? I'll tell him how many people are going to work there. Agenda 111 during the COVID, as a post-COVID, you say you need number of beds for hospital. The president in one of fellow Ghanaian series, 29 of them, no, and we can say. Or per se every city be any hospital be a Ghana Health Service, any Ministry of Health for M5, M-Country, the first no, 88. But later on we realize say, you also be count because this is the what the district capital or other place in Yabi, and I be 101 hospitals, and there by now say hospitals no, you who say also the big count over baby, is a 104, but it's still agenda 111, and then we also said say. All the new regions without a regional hospitals, there will be a secondary level because here there's level of system, hospital health system in the country here maybe find a 5-tier system. You have the CHIPS, that's the basic health system, and you have the sub-district. That's where we have the health centers, maternity homes, and the rest. And then we have the third layer, which is the first referral center, very important. Any district hospital. I guess I'm going to free. Chip centers, any baby na omako. My friend is saying, Kolebu be over flooded, Konfanachu be over flooded. That's not what we want. We want a proper referral system in this country. And second, the next level, the next specialist referral center, the regional hospitals. There are 6 new regions, any hospital. So we wanted to give all of them hospital. And then President can say, if first Takoradi, so you have a new hospital in Koho. you see an amend this, you see another new hospital, our Western region, to be a regional hospital, and refurbish a contact hospital to be a specialist hospital. The importance of this is that or nurses for in training room, doctors for in training room, now open training will be in the hospital. So we wanted to give all of them hospital. And then President can say, if first a tackle, so you have a new hospital in Koho, you see an amend this, you see another new hospital, our Western region, to be a regional hospital, and refurbish a contact hospital to be a specialist hospital. The importance of this is that or nurses for in training room, doctors for in training room, now open training will be in health professional, doctors, nurses, pharmacists, laboratory technicians, and yet direct, and yet classroom one yet. So practicals. And you Ubakono, but won't say, we work on financial, but say nurses for no qua, be our patient, be a call. I could try nursing collide DH students, bear 4 or 5. That's an EPC, me doctor, I'm a student, near 4 students on the ward. Me house officer, near two house officers on the ward. Me free of statistics and gynecology, in my 35 cesarean sections. Because you're not so. And now, your baby a year money P. Sani EPC the hospital here. Some hospitals say what this is in and should be a hospital a bit me a charade, me friend a hospital that can teach. The teaching hospitals become the university hospitals, specialized. Like I say, your team will be in the first 3 years of medical school, and I say will be in the first years in pharmacy and nursing training school, or be acquire the practicals. These hospitals are going to serve. Every district in this country should have a district hospital. Every region should have a regional hospital. That's exactly what you are doing. You're President can say, "Aka, what is a psychiatric hospital?" And also, no psychiatric hospital country, along the coast. Me wa Ankafo, our old psychiatric, Accra psychiatric hospital. Any Pantine. And you say this psychiatric hospital so come. Now yenya psychiatric hospitals. You mean see what region be at least they have 3 zones in this country: the coastal zone, the middle zone, and the north and the savannah or the northern zone. And as you speak now, you see psychiatric hospital, which is about 70 to 80% completed. So about 20 minutes drive from Tamale for the northern sector, and the ACB municipality for the middle belt. And then we will refurbish Accra Psychiatric Hospital to be a 200-bed referral psychiatric hospital, so that students, nursing students, any medical students, especially nursing students, in free wale, in free naregu, and ma pantine, and also omoko if I say ankafo akoye rotation. That is the idea, so that we are having total health system in the country, both psychological and also body. So sebeya obi ewo mental issues or baby oko. Even though there's a system in the place also to be our few beds or the acute psychiatric cases. Now it's not me treating more psychiatric nurses and psychiatrists and psychologists. And the Yamin Chadi, you will probably say, won't pay land in my and you may be in your land easy. Out of the 104 district hospitals and the 2 psychiatric hospitals, 96 of them are active. 94 district hospitals, if you were the constituency, if you were so economic. On obit Obahabu Musa and say, hey, Nedu. And a sound 2 psychiatric hospitals in a coso. The regional hospitals, apart from the Takradino, they can because of the depth research and no we are buying AC, are buying AC no equip. The can a friend will be external funding. It because of the depth research and no, you delay a crab or finance. Immediately they give the go ahead, the contractors will go to site. The progress of work, as we speak now, it be Nancy and the Nyas are here clear 5%. There are about some of them who are over 80%. Your bompire, Yame, maybe BNC, you be commissioned. Some of them, I won't mention the numbers to you. You call around, I can't say you call Upper West. You call Upper West, the person will be here next in the first week of August. Come, Brian, be here Lambusi. Now, if we are Upper West, near Upper East in area, a press conference near Ghana for this month. We are commissioning this this month you are commissioning this. In said the continuity will continue. Ghana for Adom. Now the early part of next year you are completing in so that every district in this country be a state-of-the-art fit for purpose hospital. Now enon kwan ye per se ye hospital ni we are. Your accommodation kakra ho ye ne private sector. Now we want to involve private sector in the near maybe a government afato no so. Private sector betimi aboa na medical villages were all these places. Most of the districts for no ahemfo na mayasase. Into wo ko ho ne transfer so we nurse we doctor na ko ho. Said the now it could be a police for the no far back. Wako ya furnish accommodation now akot now. Eho and a rural incentives ebemu. Ti wo rural area bia. How do you pay for this thing? And one say government the beka with salary home na ye tuya man ti any Ministry of Finance edi home komo. Enti this the reason the be 5% is a land issue, topography issue because one state of a building here. Actually, you say baby a land in it not say a double stack. The whole cities Accra, Kumasi, and Umina Afenuma. Next slide, please. Into quickly, these are the zones. You're zoning into 8. Central, every region. That's the beauty of it all. Every region has at least the lowest one or 2 district hospitals and the 1 regional hospitals. I have. And the Akano, it be 19. What is psychiatric hospital? It be 15. It be 16. Any other. Next slide, please. And these are the towns. Dia Ohe Bonzoa, you be Dia so a double crumbo, Dia so and all these things. And now central region here, Gomoa, France, any other. Nina, every district capital. Next slide. We zone 5 cover mostly upper is Lambunsi, Nikrumbi, Gulubi, or Chow, Isa, Nifunsi, Nina, Biwo. Next slide, please. And the biggest zone, zone 8, and in our Ashanti region. Because Ashanti region didn't have hospitals. They were health centers. Next slide, please. And these are the towns, and then we look at the populations. Maybe next slide, please.
Okay, so Doc, now we check our time. Now I got 10 minutes.
Yeah.
But you have crossover called Mula for 4 minutes. Near back. I'm about your presentation. You can stay here. Now you have your 10 minutes to wrap up your stuff. Ansana.
Okay,
so unyanwe.
Okay.
Unyanwe krano. We no dey be try ho aba ye ba obajebre.
That's
no was I do 10 minutes no. But areas episode of French then we pay then is question time. Inti wa utie bia na ohwe bia no. Dr. Nsiasare Mula and she share inti no. Ye be cross over to studios na fe on the game park for the call for the next 5 minutes. Ye ba back a minute edu. Now for the minute you do not obey. Now fe you nom near my man, my doctor for or boy in almost a question. That do question time. Me who say when you are blessed also a part of this. It may be quite no so I'm also to me afraid. Tia kwaba say no pa non kuna and we are premtobre and then you may no see or shebre better true game park on Mula or Mdaba. Yeah, kwaba 106.3 Adom FM and Adom TV. Bedroom Sunia de bro. This is a sectorial debate, and this is your election headquarters, Kokromoti Power. See them no. Dr. Nsiasare with the next 10 minutes to wrap up the presentation. We various agencies and associations are they are taking them through question time. No majibre at the Yana. Doc, again, Yasaba anti Otwa
in zone 1, we as at June the percentage progress. Next slide. The may go through much of pictures. We Bottom Doma. Next slide. We said that there so as at June any in. Next slide, please. Next one, please. We Kenya say any Odumasi. Next slide. They are Sony Genji. The same drawing at double room for the first time we are putting this. We call zone 2. These are the towns, baby. Or next slide. These are the percentages. Zone 2, it ranges between 61.17 to 78.89. In fact, they do 78, and now I'm catching them say it's about 85. Next slide, please. So these are the pictures of Nsaba. All the roof in the area of Moya East Side work. I will to Breku. We are France. It's one of the ones that will finish very soon. And I'm poor. Next one. We are seeing Manso, we are seeing Briku. Next slide. And these are the pictures of our swings where drone of Fonse. Next slide, please. Agoran Kwanta is almost completed. Himai. Next slide, please. We see Soayim Chichiweri. Next slide. We see zone 3. Next slide, please. Zone 3, we have land issues because of Piwakra, and so range between 10.1% to 80.22%. Where pictures because Abomosu is almost completed. Next slide, please. Where zone 4? Zone 4 were mostly part of Greater Accra and then Oti and some, I think 1 or 2 in Accra and Ashanti region. Next slide, please. And these are the percentages from the ones who have just started to about 69 or 70%. Next slide, please. Pram, see the Pram here. And Asege. Next slide. KJB. Sotium. And away, we Lambusi wo zone 5. Next slide, please. And Lambusi about 72%. As we June, as I speak now, I'm sure numbers echo 80%. We when chow Lambusi the kama fefe no. Next slide, please. Funsi Savlogu is almost completed. Daboya is almost getting to completion. Nanton is almost completed. Saboba, Saneregu, Wolensi, Golu. Where so it was zone 6, mostly upper east and then some part of northern region and northeast. A range between 31% to 77%. And Roma catch them say Drew Bear 80-something%. Where Garu, one has a pavement and the roadways. Where Binduri, Garu, any Binduri, Nanka NMS project a coho. A woman who has is a 2 district, when 2 hospitals. Where Zarongu ne Shripone, and Paga, and Sang. Bunkurugu and Yoyun, Pusiga and Pandai, Yabaga and Timpani, and Zone 7 mostly in the water region. There are 7 in water region. The one psychiatric hospital and Bruno East, and so range between 3.5 to about 74.11. Where Kajiji Diano, our Bruno East, where Peve is almost completed. Avidakpa, the answer is almost completed. Adakulu is also going very fast. We hope to finish it this year. Vegolokwati, Angonaga, Jolokuta, Tamale, where as at April, the district psychiatric hospital, they are almost completing. Petoi, Akachi, Prang, Businya has a small problem. Zone 8, mostly in Ashanti region. Go on. Maybe a president Kate Sword, no. Now we are getting to about 90%. They are doing the finishing touches, about 84.3%. This year, a commission. Next slide, please. That is trade. The Honor President Kate Sword, no. Boa mine. Next, Kokobin, Adansia Square, Kodie Barakesi, Asiwa Edujama, Mansour Dubia Insuta, and Amankraso, a changing contract and Jaffini Yakoso. Next slide, please. And as I said, Agenda 111 cover all the 16 regions. I achieve quality universal health coverage. Next slide, please. Meko straight into local manufacturing. Once a COVID-19 by and you say you have a problem of vaccines. In the African Union, I can say country be about to vaccine manufacturing how be an president to take a bold step, and then he set up a task force, 10-year program of work, and February 28, set a committee. Next slide, please. He say, as you speak, there is a National Vaccine Institute that coordinates NEBBR for vaccines and other biological preparation. So there was a lot of things that have gone on. We've brought the FDA. We are now improving our FDA from maturity level 3 to even maturity level 4. Regulated so that whatever happens, like I say, vaccines. Next slide, please. We are working through 2 giant pharmaceutical companies, DEK Limited, ROC, a factory from the scratch. You say, as you finish speaking, the stores in BBR onto the factory format. and Atlantic Life Sciences, so and so almost factory already, almost has a cry anti-snake, which is going through testing. Next slide,
okay, so
we are
no enough here, Doc.
Come what they about course America. And these are the things that friends, vaccine production. Next slide, please. It is gone through all the phases. Next slide. Then another important thing that this government next slide, please. A zip line. You are transforming Ghana's health sector with automated this thing. People feel say digitalization agro. And rank one I call launch impact assessment. It will hear SDG goals and was say a cover SDG goals now. There was 6 distribution centers, a cover about 13 districts, and the population of about 17 million, about 3,000 facilities. The two baby are empty in Savannah area or upper west, so I can cover about 96% of all the health facilities in the country. Next slide, please. And these are the 6 centers. Your commission in next slide, please. This is how the 5-year journey is. You hear say be gross but I say it has come to stay, and Ghana and the largest medical drone distribution service award the whole world. You train about 200 decent jobs. You say be the global operation director or a Ghana nearby. And the interesting thing is a man is 60% of the workforce, and this is the drone instant what we are doing. Okay, now.
So Doctor, I'm sure the questions will capture those that were not captured by your slides.
But what they were Doctor can say, human resources,
human resources,
could be next one. Human resources. Since you came to power, we have employed 170,830 health workers. Next slide, please. Or can we say next slide? Or can we say Agenda 111? No, human resources plan. Human resources plan. These are the workers per every district hospital, per every regional hospital, per every psychiatric hospital. So we will be needing about 68,184.
Dr. Cesare, thank you so much.
I wanted to make this fact clear.
Thank you so much. Thank you so much. Question time. Professor Pacho, we'll start with you. Said Ahana, Messe Ekua Hudurinana. And I've gotten the report say Binimu Amunko for Ma, so much Amunko for the Manabisa. Beyond the 2 questions, there's no problem at all. Because Mary who said and also their mind. Specific questions for the NDC. And Sana Ebe and Pacho, Ekobia di Kanfa Ninipa Bako. Specifically for the NDC, to the specifically, all the questions is purposely for the NDC. What question for Professor Bayu? Madaroma. Mike no unia okra. Mike no wachi. Eti ujina wa Brenda Sope na ama kwenya na oti bebusa. Kofi ajosi ebe clearly for the NDC questions are the NDC. Yeah, that's it. Yeah, sure. We might just in a minute. Yeah, but neighbor try and come on so. So Asaba, it's question time. Professor Bill, are you ready? Yes, sir. Who introduce you now? If you want to ask a question, Patron O'Harris Kakemay, Wadaruma.
May I say, baby, I'm Patron Midin de Kwaku Frimpong.
Kwaku Frimpong.
Yes, me a director, the Savior Church Health Service.
Savior Church Health Service.
Yes, the Savior Church Health Service.
Okay.
You better impending for Nasi for presentations now, my no. Now, my question no on the energy sector. Any energy for health. Say, Prof. Kasano, or make a lot of discussions on health financing, but 1-0 down to a haunting bisa question when I'm sure how they would help us if they come into power. Over the last 3 years.
But specific. Is your question bordered on energy challenges in the health sector?
Exactly.
Okay.
Sure.
All right.
So over the past 3 years, energy challenges are very, very hectic for those of us I work the CHAG fraternity. On the average, CHAG facilities are spending between 40 to 60% of what they generate from NHIS on electricity, to the detriment of Senka, better essential drugs and consumables for healthcare delivery. As I speak, Pentecost Hospital spend 40%, and Kransa Catholic Hospital spend 60%. And Kransa Catholic Hospital are spending 60% of what they generate from NHIS on electricity. The worst of the issue is these energy providers and also force institutions to install prepaid meters, and also very difficult for hospital management. What I see is a threat to sustainable healthcare delivery, any Ghana's attainment of universal health coverage. And Timpesemi Bisa, Prof.
Okay,
so what are they going to do?
Yeah, that's it. Yes, thank you very much. So, Prof, note it. So, it's energy. Yeah.
Medase. But you have me, Reverend Dr. Dennis Sena Awiti, many Executive Secretary, Pharmaceutical Society of Ghana.
Great.
I say, Bisa me wo, Adema, Madam Fo. Prof. Ni say, Oye Obia, Waye Juma health sector, Oye health professional. We took one so, Yehun the ACA wo, Amanone, baby, Yenina Yepese. Ye man crab yesa awa pomodin fam ye hwe sa ye hu se community pharmacies ewo amanone no ye use omu yi enti obi finifia bibi okoho a enye enro nko a apomodin enti bibi UK so mo bi from pharmacy first enti community pharmacy is part of the structure of healthcare in general, but the bag and there be.
So your concern is what they are doing about?
Yes, how can they integrate community pharmacies as first port of call or first point of contact in the health sector, so that it can cascade upwards? Yeah, almost referral system, so that there can be a follow-up in terms of referral system.
Okay.
And to make us community pharmacies, you become a primary healthcare center, an integrated one.
Okay.
How can that be possible?
Okay, thank you so much. Minyaba. Doris Aban.
I make a National Association of Registered Midwives.
Okay.
Me a midwife.
Good.
Prof. Mokasan one can be via a welfare of nurses and midwives. The person me bisa will say, and she shall be na more woman nurses and midwives, a buy a welfare one. And she shall be na more and my. Dear Tosuminu, more she shall be say, polyclinics are a war Ghana ha, mubet me upgrade a B iron hospital. And because sure most of the polyclinics bet me upgrading no hospitals community now referring them to bigger hospitals say Kolebu region minimize it.
Okay.
Into more and shey bi sa na.
Okay.
Mr. Masame torture. Me pa chow say midwives and I say nurses yet use bi our controller and accountant general every month.
Okay.
At the end of the month, no, omudema various associations, no, to run the association. As I speak, yesika wom, me pa uchomu ba, and I say nyame ya wadom, na samuba enhye ben, and amoya fa say sika na controller and accountant general etete no. Every year ho. Some mudema ye various associations, no, they are running a business and came.
Yeah, that's it. Me about this issue. Yes.
Me that's bebre. Pacha, your friend Esther Bamfo. Me kasama Community Health Nurses Association.
Good.
Me na me national president. Honorable me pacha Miss Rebisa. Okasa ye no. O ma ye enema mo ye etwemu. Community health nurses and the Juma, me find the first point of call. Ewo baby ayete. E crab baby ase, even and you will chrome because you see our chips without wall. Yante hu baby ase, what me improve chips from A to C. Any pay ye Juma or logistics on the ye Juma. Yante hu baby, Miss Rebisa say. Any pana a ye Juma as community health nurses, so no only a keda, be fast a keda, they need to rise. Some more bar. Edian and Amobeye, Ediama, this caliber of nurses. I want Suku Semo, Amomatumia Comenim, and the requested skills, knowledge to render the health service to young Crawford or more air show. Ebium, ya struggle by your Yamiadum and a committee nurses yet me a diploma basic degree. Wakwa where we in sono, or conversion, ayasem. Edian Amoba Mobe to me, I am a Huso Nipani school pay. I see it me convert in a managerial position. Okay. So, na nene to me aji ejuma no aye. So
ya da CP. Me fa nipa 2 year twa to na fe. For what me quickly aye no adama. So energy community pharmacists and this committee and all those, I'm sure you are taking note of that. Quickly, Minyaba.
Okay, Patricia, from Charlotte Adom, me represent Ghana Registered Midwives Association. Me a midwife. Mm-hmm. Okay, number one. Salaries. Prof. Eka say most essential health workers figana akwama noni. Dienti na obi be figana de we no akwa kotina wom. Sika no. Our salaries are nothing to write home about. Sika ya mu na ye transport. Eno mu na ye tuya your rent. Eno mu ena ye bibia. And there is no market for the doctor, a separate market for the nurse. Drum nanka say me a midwife into entertain your maso my there be yesikano on what project here on the average midwife or 3,000 and kakrebi and that 3,000 busumi munina. It's not going anywhere. You call for negotiation near Yadebe table no so government representative or bebano nyo peno and no de maying.
Okay.
One example, recently omoko negotiation. Okay,
so the bottom line is that Musikano is sharp.
Yes, but me pesa me manche mu kakra. No,
but over for church say negotiation table come on and no another. The point is that you need an assurance that they will do something about it.
Something must be done about the salary.
So, Prof. Quickly, nipa beisia. Who said the chat to any about the hand upon midwife? No, something must be done about the salary.
Seriously,
you know. Okay.
Yeah. To me that say any monsembisa. Say mutie in common yedi yenu eye. First one or bisa say energy no. Minka say the energy sector, energy supply in hospitals. When we're in this power crisis, one of the advocacy I can say it is something we have to consider is using alternative sources of energy at our hospital. When we were in power, na hospital the government was absorbing the bills of all government hospitals. Now, what happened was that due to various challenges, this government issued a directive to the hospitals to try and pay their own bills. this directive, the problem I made our directive no one say. It didn't go. It even went mid-year. Now on my budget, more prices are approved by Parliament. They cannot even go and change their fees, and there's no line item or more fees more for this energy. And then they were asked to pay from the IGF. Into what they are threatening say better more light more. They are change prepaid meters. So that whole transition, I think, say planning a year kakra, and one other advocate I can say in the communities, and can say a different grade system for the hospital. Say the team who say higher industrial area, even say a schedule loader, we can protect them. But hospital no community, it gets the supply and everything within the same community. Until Doom and Probi hospital so go off because it's not protected in any way. So one of the things we are looking at is exploring alternative sources like solar within the hospital, looking at different metering system for essential and non-essential areas like theaters and the rest. The metering system there should be different from non-essential areas, and then making sure that they're combining these power sources now we can help. And if we even have to maintain the system where the facilities pay like the charge for Nekano, then there must be negotiations on how the billing should go.
Okay, so community pharmacies.
Good. So community pharmacies, it is true, play a very essential role in the healthcare system. Now, if we want to adapt the community pharmacy into the primary healthcare system, there are processes I would say you from. One, I don't doubt the capability of the pharmacists to deliver, but we have to look at their distribution. We have to look at data collection from that place. They must be hooked onto our data system because we need data for information and for planning, and it's something that we are willing to discuss. And Nyamiya Adoma, the Baba Mo AGSM, no, we will sit and discuss with you. Take your proposal.
Community nurses, correct?
Yes.
Yeah.
Community health nurses.
Health nurses, yeah.
Yeah. Community health nurses, no. In fact, before that was the welfare of nurses and nurses and midwives in general. So as I make the welfare of healthcare workers in general, and nurses and midwives is something that is paramount to us as a government. And during our time, we are signing all the conditions of service, especially starting with the doctors, and then it replicated to other cadre of healthcare workers. There was a concept we started discussing, and it went on to this new government. I was fortunate to serve on a committee, this new government. So that time in my my past role as GMA secretary, I were looking at incentive package for health workers in deprived areas, and they also have deprived skill. And you are the only doctor. Untimin ko leave, untimin locum, untimin she, Nyawajay or Kitcha, or Lambusa, Usa will fear back baby because Ebia, a crabby cry to her, Ebia will ma enter school and call Ewo a honomu, into well keep you or family, Ebia or Crocesium. So you are forced to keep two families. For such a person, no, there must be a package. The person should not take the same like Obia or Kolebu. I'll bet me upon Kolebu and Apa. No, I call private hospital be area. And now I will take some upon how bet my baby, midwife upon how bet my baby, but midwife will rural area. No, Nejumani 24/7. So that incentive package that must include accommodation, a percentage of almost salary to cater for what they are sacrificing to be where Obia M-Pesa or Bekono. We think these things should be implemented. And generally, the working conditions need to be reviewed. And then deductions not paid. It's a major problem. In fact, World Medical Association, not a problem. And it's not only your dues. Dues no crime put there. It's the unions were fighting for it because they needed to run. It is getting worse in this administration, and it's also affecting your pension contribution. Tier 2, I'm a licensed trustee of one of the Tier 2 agents. Yatina Kase de Bana, Mobile Invest, Manipani pension Awenyano. About 5 months in my
Dr. Professor Beyude na Mubeya, yes, I'm a Kaisika.
So, and I make say it must be a deliberate decision from a bank say, what tier?
So the assurance is that?
Yeah, tier. yebetua.
Pachomati. The assurance is that yetia yebetua.
Because yewo no na bibi science. Yewo ho na bibi science. Iti yetia yebetua.
Okay.
You can hold the NDC to
so
that.
maybe last some 1 or 2, then you have a seat and then
yes.
other people.
Progression and conversion. I think that one, some of them know administrative delays, and based on the system you use currently. Even when you have gone all the document entries is centralized into this obiako. BA system now enter that one alone can cause a delay for someone. Obia we in school some promoting na on nyaye. And then the community health nurse thing, I think it's they are critical part of the healthcare system. In patients and they follow and do all of that. But a lot of the time, no, they are down there in terms of in terms of the incentive package. And I mean, say, idea. We had policies before.
Okay.
We're taking good care of these people. Okay. It wasn't the best, but yes, community health nursing has been upgraded now. It's not certificate. A called degree.
Diploma and
degree. There must be progression. I'll bet me even some person be a general nurse onto another area or into public health because it aligns very easily with public health.
Okay.
Yes.
Okay.
So, and I make us say, once you call healthcare anymore.
Yeah.
All the cadres of healthcare workers are equally important.
Yeah. And
we will provide improved salary packages.
Okay.
Incentives that will cover everybody, including the midwife.
All right.
No problem back when you midwife now midwife me ma say no you can't govern the sector.
Just 1 minute comment now for your Dr. Nsiasa so more person who say MPP question but this question more fun chemi or back but or just wrap up on this question segment.
So my last commenter me person me can say no, I cannot. I think I've answered all the questions on my visa.
Whether they are satisfied or not is another matter.
Another matter. They can come up as other questions that I can answer. But the zip line was my presentation that I couldn't talk about. What is the source of funding for the zip line? Zip line. Because the shots here, no. Omampeni, Abedi Kache and said they were never going to use public funds. They were going to get corporate, NT, and the rest to help them. And we are seeing say it is coming from the
Dr.
Just like Cathedral project. They say
Jessica. Dr. Dr.
And the last one, Eurojet project.
Okay.
Mete omi say me wafaka say Eurojet project no. Omo pesca de to ho say ye ba. Ye mfanye ejuma o wafa pesca to oba ya 8 years one year. But
Prophet Joe, rebuttal times remember.
But information I mean 1% me clear say you jet project no. Ska omo pay no. Arab Spring buy no. E mas kasem no be ye.
Okay, so Professor
and we have to arrange new funding.
Rebuttal come. Yeah, that's it. Me ma me nko ginachiro, me nim say ono dey the general questioner. Ma ko ginachiro, ko gina mic nachi. Me nim say o dey no the general questioner. Me nua kwesi nsianso ba come on. He will take Dr. Nsia aside through question time. Akwasi, so my question general for both parties or specific for the MPP? Both parties. That's very good. What about your MPP question beyond Pamacho Madaroma? It might be the because the special request baby a bias or some mamma means some original. But your train Kakrasa, Doc, why ready? Why ready?
Now, paper and pen.
Paper and pen is here. Akwasi, as you join me for paper and pen, the brand Adom 106.3 and Ocean Swa, a big game on Adom TV, an extended version because we're sectorial debate and contemporary between the major political parties, MPP and NDC, and our conversation has been on the health sector. The last 2 weeks, what we discussed was energy and the health sector. It might be on sector the next time round if it gets ready. You have the education sector, you have the road sector, you have the aviation sector, we have the information sector, and all other sectors will be covered. And so now, December 7, 2024, what you may use to Kukumutino at the Akoto Aba Otono, Ujidimuno, Otiasia, Dientia, Otosa, a year, Abano. Whilst we wait for Akwasi quickly, all of us in Brenocrat and Temnafi.
Dr. Insiasare. Penny ni paper no breno na draw questions. How pen brother.
So Akwasi joins me. Akwasi will take you through all MPP questions. No, Dr. Insiasare, MC. Me mama de chassis.
Okay, Mame, Dr. Insiasare, Presidential Staffer and Presidential Affairs Officer to my penifo ewo apomdeho. NHIS the new Patriotic Party. But your question I ready, Dr.
Sorry. Yo, Madam Wasibebre. Me Fiji Ghana Registered Midwives Association. Okay. The association be a midwife association. Private sector and so come.
Okay.
Na nienti ameka samede general no. Omi enu ye nimu ni oba. In the private sector, Jumani and Crawforby, our friend stakeholders, the EPA, the fire, and Niakika Kahon, NHIS Kahon, Hifra Kahon. Mr. Musika, one more free a hono. A doss to do.
Well, if I tell me, one muna edges kadi free more.
One me bobo indi no.
Okay.
Stakeholders no.
Okay.
If I think about a midwife bia, or didn't when see her akwa share a crabby ase, na all year juma. Na afe in fear me no, na yaba NHIS edgy, Hifra edgy,
okay.
Fire edgy, EPA edgy. Apart from taxes, I say
yeah.
Inti ya district DNA say. One year no nyina wo ya yenim say nyame adom a wo mu ba kono oba. One momodi na private sector wo mu hu ye mobo kakra.
Okay. Mate.
The private sector includes also the private doctors. Na say sika ya make us ye chiachia no wo mu su tua bi. It is a public private sector agenda no. Emana ISC DIS
okay.
Private force and a dorsal.
But I say, maybe you remember. But also, Dini Babia or the Friva.
Meeting the Reginald Sechi Brown, now may represent the Pharmaceutical Society of Ghana. Now, Miss Yankan Kre, Mina Mia, chairperson for young pharmacists that work Ghana under the Pharmaceutical Society of Ghana.
Okay.
Na mini anu mother for pharmacists omutie o Ghana ni amanoni na omu question 2 for the NPP.
Okay.
The first has to do with the recruitment. Me will say opening Dr. Insiasare represented some data on recruitment of health professionals from I think 2019. Na pharmacists to BAT and pay serious issue concerning recruitment. Tinupese MPP for etimimae almost clear plan on human resource for the health sector in terms of employment. Pharmacists almost about 3-4 years ni pharmacists any recruitment into the health system. And most of these people are young pharmacists. What is the clear plan? Because if there's a lot of conversation around, say, developing hospitals are, what is the human resource plan for this institution?
Okay.
And secondly, so once health professionals who run a system anymore, they also have to be also upgrading almost skills. That is where, for instance, we need to say the Ghana College of Pharmacy, Ebeba. May I say the earlier presentation, Professor Beyo can say he is a beneficiary of the Ghana College of Physicians and Surgeons, and that is the reason why he decided to stay in Ghana. What is the clear plan in terms of postgraduate sponsorship for specialist courses for pharmacists in Ghana.
Mami.
Okay. My question is the two political parties.
Okay.
I said, yeah, mama can you beba. I say we are health personnel, we are Juma hospital. And so there is no policy in place. Say be a unipana woma and call for moyarino. So we are.
Okay.
There is no policy in place. And any ABA government, the hospital is to look, treat you for free. We are Juma hospital. Me a midwife. Me wo me hospital. I'm expected to pay. How?
Okay.
Enti ye bisa say omoba sa de no kwa de omo hwe no mo nyema ye.
Okay.
Thank you.
We are beba.
Okay. Me pacho from me Benjamin Jerry Anane. Me kasama National Policy Crusaders Association of Ghana. Me pacho me question common both political parties. Now, in the course of presentation, nobody talks about dialysis. In this current situation, there are a lot of dialysis cases recognized in the country. So, omoba, for how to know the consumers of dialysis.
Yes, my for last now for Dr. Ejimi Enyi kakra na banana yen to us later. But what didn't be a
Medin Eddie Alfred believe Ahiachi.
Okay.
National Policy Crusaders. Yes, per your data no HRA say there were 6,000 plus registered doctors in Ghana. 6,000 plus. Now, when you go to various hospitals, doctor, professional doctor, what they yare for a course is here, they will attend to the patient. Almost a nurse for no and a bekusa.
Professional doctor now come
I'm talking professional medical doctors. One like a bano doctrine now or more grade no mimi okay. That's why I'm using that terms. Say because a doctor ebe attend to your patients. Is your doctor no ewaha or beba next week or beba next month. Say at the end of the day no. Now why should it work because of lack of doctors who will be available.
Okay.
Me person me bisa ya papa Dr. Insian Asare. Say a day ena omo ye afa eho aspect no ho ama Ghana for tosu mienu
last one.
Say enema kakra echire ya adwen efa blood policy uko health sector. There's a policy called blood policy, but when you go to our rural areas, say ya nchire mu a obi ehun say your policy be a friend blood policy. Mpese obi ya adwen kakra efa blood policy ho. Any nhihye ya aban ebeye e de afa ho in terms of blood donation. Thank you.
But say, doctor.
Yo, me that's it. Me here say free. The last one, no. Say doctors say 6,000 na. Oko hospital no doctors ni ade. No correct. You see the tra say ye pesi ye say. On say obia sorry no kokolebu. We sorry no okoha. Tie wo proper referral system a. Onko hu ni pi say go kolebu. Apart from be emergency room. To call a be a doctor professor ako he ho area. Oni no book appointment na ako. Wait my say na many nyina no. Also we nya levels of care. Ni nya proper referral system. No and amaka say ye die go kwamu a ye ho enkrata. And osambu say bi say there's a blood policy. There's a blood policy, national blood policy. Say e bia ye nka ho asem ti we matwarato or say timi eye ho pensenpensenmu yentimi enka ni nyina wa ha. By ye in such a way say yewura frag better have ka ho asem. Mbese me bie so ha. Ene ma pese ye ema blood policy no. Blood policy papa. It's over another part of the blood policy and say you use drones. The far blood ko be anka first no. Chire den ko fo sick nipa ko ho twensuo ekoje 1 pint of blood. And far blood is because of sad drones to use so no. blood and crown ye plasma free near pack cells. Ti 1 pint of blood, it in my bed upon you. Ti a policy. They also try this I per se. Ti mean coming, me cancer or be manifesto, you know. Tinin Abeba. Will be the last but once we will say about dialysis.
Yeah.
And then, but actually, I create me short. You see, your chronic diseases are and yet kidney. Who say you near my mouth for 80 kidney problem or for dialysis. Dialysis and yet the treatment for chronic kidney disease. There be dialysis. Thank you. Prepare one transplant. Dear Nemaneba and Colabio hire the womb. Yes. Into the person, he say health insurance, next time also free, be never can have health insurance. No, the person he say the medical checks, my friend, and penny force be cool way. Once I'm called or yellow cool way. I have insurance for a pound to Mamsa Monday. Yes, a biafini, ye, Sacrana, ye term of office, we are signing a call election. Nipa, offer more hypertension, hypertension, diabetes, the most frequent chronic renal failure. Nipa or hypertension or more treatments, we say no. About 70% women in class of hypertension, who is going so soon. What a shock! Also, what what one name Chiana for when you stroke. When you stroke, so we also chronic renal failure. When you chronic renal failure, now we a billionaire. No one fee would do sick in dialysis. Because all your dialysis at least 2 or 3 times a week, depending upon your state. It's expensive. Upon a boarding also be never. It took us a DNA dialysis for and saying you pay dialysis for whom how you can say a mofra up to the age of 18. Okay, dialysis are a colebuni near free and a penny for so above 60. But in the majority of also most of them are more dialysis on a young middle age near my 2 sessions. Say yet mean the way a pilot near his baby team high bit me I know. But we dialysis no now baby swa a bit me a renal transplant. Yamin Chadi, you were doctor for, you were nurse for, you were pharmacist for our cushion who named dear Anna Senko for ba ye be a UGMC in the bank hospital name and never collabo for conference for her CBB. The lobby a minister cabinet on the organ transplant and donation and transplant, tissue and organ donation and transplant. Sebeya ibenya emra. Omo mo ye IVF nyina no emra bia ne hozi sei. Ni nyina be cover wo. I pese etimi yesebia ye ntimi anya ne this term of affairs parliament ya ebia early next parliament also mutim pass. Na yese ye wo ebia me be wu amese mani for example nipa enya blindness ye won kofo mutim ye cornea transplant. Most of them a cornea ulcers. Na ye stretch afi. Woman of cornea here. Otim hu ade. Kolebu for tim ye konfano for eye for tim ye. Even for Cape Coast for tim ye. Enkofo ba omo de omo organ ifira broche de ba na de abaye. Omo so omo ye within 10 hours no mko. But nipa de obi ewu a okatena ni. Tie wo sa law no ho am be wu amsmani we mienu nyina monyi na momfa ma obi so hu ade. Enti ye be pass sa law no. But the most important thing is near my sad a chronic renal failure, but acquire dialysis. No, and only ever use free medical, will be all health insurance. No, quite check it once a year or birthday. Now say birth week and I say birth month. No one say who develop hypertension. No, I can what drew. Not just when kunya renal failure. Inti if free be early detection and prevention. Near my mouth, yes, I no prevent it. The early detection, no treat it. Sebe go into chronic renal failure, work of dialysis. They also be able to say, a private sector, so be Cambum. Now, every region, every district, hospital, AC, will be to set up a dialysis center. Say, free Bogoso, Emma, friends, Kolebu, may dialysis. We have a comprehensive plan for chronic renal failures and other chronic diseases. Now we have insurance, they have certain you can see childhood cancers, Nina, they have insurance. But and complete health insurance, no, near yen come, I say, the above for digitalization, I what you feel with me, I hash 929 na what me first near Kosalai Kodaho. I just say, they can't card the company. Just a gun and Nibia health insurance so that at least the basic health systems, you bit me health insurance. Now, we will say a question about health planner. You be yama health professionals. I mean, they def tell everyone say, oh, hospital, wow, say Triaka. You baby, a teacher, you cry, and watch that, you cry, and the young teacher, need about wow, child, free. 77 if you didn't work private public hospital in my name and abaneto nipa ho na bani tuye omuka nti my adwuma wo hospital da my running hospitals da all these things hospitals should be able to plan for it for your own workers but going forward you know say you are there for what health insurance emfa bibia at least the basic 95% of our bed and the
doctor my name say none question here direct say
nti me baso
dia na mo beye
na say ye pese ye ne me work Ghana Health Sector here say ne pese ye bi no health plus enti ewiase we bibia obi aye bia no obi a contribute to something small for the health okwa brochire bi 25% enti ye be set up system ne encourage health professionals ni nyina ne aye another reinsurance system say dem go for yeman for apart from health insurance nti say oyare unya bia unya back pain and say unya heart problem a obetimi akoya a untua bibia che say health insurance befa aban betua bi na for nso atua bi nti ni nyina ye part of the system that we put in place nti sebe ya obi a ho beto no na ye health workers nya hwe omu yi ye to so bi emu ye pharmacists for nso busa about human resources plan
yeah
I'm saying, we plan for agenda 111. Next time, I go into details of all the health professionals. Nipa do I hear baby. Open so your health hospital area. Nipa also me both pharmacists, laboratory people, nurses, ni bibia ewo. Then ye ku anymore no. The ye say ye pese ye proper human resources plan. You see, I'm saying, I'm saying move ba ho. Ministry of Health say human resources for health. In number of your staff, nipa ye train mo Ghana ha. Nipa do a yafa wo mu, nipa do a yemfa wo mu. The woman say Ghana ha no, your country be 99% of health professionals yafa wo mu country ha wo ye adwuma nyina. Eye aban. Your private sector involvement in issue apart from charge for your boa wo mu. Private hospitals, ne private pharmacies for nyina by ho say any pharmacy midwives no. Omuni abekasa say ade na aban enye de yema charge for no be emma private for. Yes, I know most of the nurses will not be sitting at home. Meboa. Omukra de omuwa ehwemu say ombetimi atua say scan because obi okọ private no person onya job satisfaction. Obi also obi anko private or private okra no kakra no onya financial class no ba ban mu na osaye locum ho. Sebe ya obi abenya ne staff na say ka say wo ye hospital wo ye polyclinic. Eno ene ne private sector for transit private sector for so mo association bi munya obi okasa kire mo obi busame strengthening private sector involvement said there na ye ma say second question do said there na ye be ya ma because we tutu sika okoye bibia in fact regulators no home so hia omo IGF ena Dr. Kai and also Professor Kai we say we say bill be about charge of government hospital be also called parliament health insurance so no omo tariffs no for services no also say omo ye pese omo ye continuous review first na ye no na buy ne fa all the can my hospital adwada buy omo ntua but ye de come buy na ye so kania no but electricity for so here omo sika light water for here omo sika nti also otua omo ka it is service say service charge wo ho a was say ye tibi factor bibi service charge no mu ewo omo health insurance no so no any private health insurance nya because we are giving service na they say I did solar energy abeka ho ye solar ho ne ma say ye bi solar no they say ya hase ni say afi ne be hase
it doesn't mean say ye ntimi nya bibia mfa on with the amount of sika omuchia to the various stakeholders no
say a public service parliament ma ekwa no
okay
and health insurance most of the people will have insurance also have insurance tariff so almost I say almost a service so that they can factor in utility bills.
Okay.
But you go forward, Dr. Krakan or Kanwasem Kakra, you also diversify energy system in our health facilities. And when you mentioned, you will be home here, almost solar for infinity X-rays, CT scans, and electricity power. They are also efficient in the use of our electricity, because when the hospitals be air conditioning, so say one more office, one new office, so basically, if you go no more weekend and no more fee. The also system here will pay free them hotels will be no can no call off.
Okay.
The sign was here no. And the last question here.
Yeah.
That's my yini no.
Yeah.
And me strengthening of public-private sector. Who here ye? There's an association be a from Health Federation of Ghana. In the Africa, now same meeting be Abidjan. That is the way to go. There's a lot of private investment outside and go for private hospitals, private institutions.
Okay.
In the mon previous Health Federation, nurses for pharmacists for na monya a voice obeka sama mo a ebetimi ama aban so yeso yebeboa mo na motimi ene sa Africanism Bank ni African Development Bank for no e wo sika bia African leaders meeting all the AU presidents no say more private sector, because we need to strengthen the private sector participation in health in Ghana.
Can I say, Dr. Insia Asare, Presidential Advisor on Health and Education, NPP, ama you can now watch it. So I
didn't pharmacists for us will say about sponsorship of postgraduate. A Ghana College of Physicians and Surgeons. That sponsorship is there.
Okay.
You best strengthen and cover both College of Nursing. And the College of Nursing and the College of Pharmacy. In fact, Allied Health also could say almost in your college, which is very good.
Okay.
Because baby you draw no, you do baby also. In fact, you move from healthcare assistants in healthcare preventive for no, eco degree nurses.
Okay.
Near postgraduate nurses, near specialist consultants, and even those who can also develop into the academia.
And I say, Doctor.
PhD holders.
Mayankai is a National Association of Registered Midwives Ghana for and so pen for Chadama so Mabeka Jumedio Emano Dena maybe a phone line at him. Na Onsua Uwofie, ya Woshaye, Otosutomunso Eshaye, who question me Edema, both MPP and NDC reps are a warnum. Combat me a fast swabwa, I'm a health sector at me, Ejna. Also bet me a phrase 020. Okay.
Talk entrance.
Yeah.
Na obesaba ba.
Obesaba.
Because only Professor Bayu rebuttals be
on me free one
rapper. Yeah. Doc, that's EP. So that's it. You have pickable questions, no? Be a pick question. On be no appropriately. My answer. No one can say no more. 3 minutes. Be the wrap up with the my. My main cow says, "Oh, fear person Freya. Oh, baby, I'm on the phone. Yes, Ramon said the more text message, but you want to be part of it. You know. In fact, the go through my question line here, comparing your health system, no, to health system. There, woman, and I'm talking about the mass exodus. These two political parties in the Ombeye and the Afahon. Question Pacho, announce the numbers.
Number is 020-903-4979. 020-903-4979. At the screen is also, it's UT already also, or share on Facebook, or share on YouTube. But me, I join here. Free. Now, so question ya war. Every edema and penfue no money so no edema ya pom den se o mine and so bet me a phrase 020-903-4979.
Okay, so after your mics
yeah,
my main cow say Professor Bayu and a Dr. Insiasa Misremo Monty free microphone dear Mobebusa na Montron to on my these are internal people on Bebusa question. They operate from Accra Digital Center enti here say big German in the chair. When John Mahama Hall.
But so this your election headquarters. Kokroboti Power. You pick call online so.
Okay.
Hello, good morning.
Good morning.
Me patro this an African.
yɛfrɛ me Ibrahim Saki, me nurse ni wɔ Kowa Franklin South.
Okay, yet you.
Pacho, master man person bisa mpanimfoɔ no mmienu ne sɛ Ghana ha because of postis na nkɔ so no yɛwɔ backlog each. So if our leaders think that nurses na yɛ abundant I don't think almost so for nurses maybe nkɔ other countries to say the Cuba for a year na MY at least they can deduct 30% from one to crime na aboa man.
Yeah.
Then I'm better to pay for you.
Okay. But it has say. It's also faces a nurses no doors.
Yeah, export.
Yeah, export TB. And for Mco Amonone na a month for baby Nakasa Sutiminia Eduma. Hello, good morning. Okay, Patroni, Yemra if Yadom. Mamma Pacho, Udini BM.
Pacho Efreme Esther Bamfo, President for Community Health Nurses Association. Me Pacho Mesre Ebisa NPP ni NDC nyina sɛ ɛde anhyehyɛ na ɔmo woma community health nurses adwuma yɛyɛ no
Pacho si dear nurses
community health nurses
okay
motorbikes ɛyɛ major logistic a yɛde yɛ adwuma
yeah
but na betumi ayɛ sɛ about 50% of community health nurses ɛwɔ ɔman mu no ɛde ɔmo ankasa motorbike ɛna ɛyɛ adwuma no ɔmo aso na ɛtɔ ɔmo fuel ɛgum
okay
bibisa sɛ ɔmo ba ɛdeɛn hyehyɛ na ɔmo bɛyɛ amasafo yi enya motorbikes a efiri aban hɔ a ɔmo de bɛyɛ adwuma ebiem logistics community health nursing back yɛde kɔ home visit render service no ɔmo ankasa so na de ɔmo sika ɛtɔ nneɛma egum te den na ɔmo bɛyɛ
osi deɛ na mo de kɔ deɛ
home visiting bag home visiting bag bi a wo de
bag na ɛsɛn mo kɔn no
ɛsɛn yɛ kɔn ho a bibia wɔ mu a wotumi de render service yɛn ne yɛtotɔ bag no kora wa na abɛtɔ no wasan atɔ mu nneɛma nyinaa agum ɛdeɛ no mbɛyɛ ɛde abo ɛne other logistics a yɛde yɛ adwuma wɔ chips compound ebi ni hɔ ebiem accommodation ɛyɛ problem ɛwɔ chips compound ne titiriw nti ma yɛn nkurɔfoɔ no feel insecure akronfo timi bowura mu na ɔmo akɔwia ɔmo afɛ yɛ threaten yɛ members ne yɛ abuse ɔmo rape case ɛnkyɛyɛ biara no savannah area menkɔla ne baako kana yɛ rape but na ban ho nipa fɔrefɔre nti no asɛm ne yɛ one time and ɔgye transfer insecurity ɛdeɛ na ɔmbɛyɛ afa ho ebiem ɔmo pra in the course of discharging their duties mpakyɛw yɛwɔ nipa bi a ɔmo ayɛ incapacitated ɔmo pra ɔkɔ adwuma na moto de ne hwɛ ho kaa bɔɔl ne moto so yɛtwitwa ebi nan mu abubu aban no ɛnhwɛ wɔn adwuma na ɔmo yɛ no association ne individuals nankasa ɛna yɛbɔ saafoɔ no ho ka ɛdeɛ na ɔmo ba ɔmbɛyɛ ɛde ama saafoɔ no yɛdaase
ɔmama yɛnkɔ ahoma no so biam na yɛkɔdi ɛkɔmɔ hello good morning mepakyɛ odi ne sɛ na afrɛfrɛ
Mejidi Mohammed, because free Amanti Central.
Okay, you too.
Malcolm say, CT scan. I say, we name the extra. Hospitals now say, Amanti Central, for instance. Hospitals are maybe we say war around them. Who said, yeah, I'm tired and you are. Babies will be a due to the symptoms we are feeling. Okay. And I due to doctor's advice, and so it's not common to be done.
Certain tests to be up so
yeah. Who is opinion up and also educated about it. And a program unless you have a request form.
Okay, so you better about question where them say munya the whole yemra in house pacho wash your glasses semia wadaruma.
Yeah, thank you very much.
Yeah.
Okay. Pacho Medidi Frank Toblu Richard.
Good.
Okay. Speaking for Private Health Facilities Association of Ghana.
Private Health Facilities
Association of Ghana.
Good.
Now my question goes to both Dr. Isiasari and then Prof. Bayu. Okay. First, Prof, you accused Dr. Isiasari for not recruiting
the MPP, not the MPP.
The MPP,
yeah. Sorry,
the MPP.
Sorry. You accused MPP for not recruiting nurses trained from their various institutions over the period. Can you tell us what you would do different to increase the enrollment in the institutions, and then also recruit the current people at home? And we have first question.
Okay.
And to MPP, releases to the National Health Insurance Authority in the year 2020 amount to 790 million Ghana cedis, representing 34% of the total amount received from the National Health Insurance Levy. In the year 2021, you again released 127 million, also representing 6% of the total amount received. My question is, where is the difference of 1,546,000,099 in the year 2020, and then in the year 2021, the difference of 1,928,000,000 where
are you able to help out with your source?
Yes.
How you arrived at this?
Yes, I can give you.
Okay, so
I can give you very clear.
Thank you so much.
That's one. Then to another one, what measures will you put, this one to both of them?
Yeah. Okay.
What measures will you put in place to completely eradicate co-payment, which is one of our major challenges in the health sector as far as the private health
completely eradicate what?
Eradicate co-payment.
Co-payment. Okay,
if I should explain that briefly.
No, it's okay.
Very well.
Okay.
Now, taking cognizance of inflation, exchange rate fluctuations, lending rates, which are major factors affecting the healthcare service provision in the country. And lastly, what is your plan for the private sector in terms of posting nurses to our private health facilities going forward into the future?
Okay.
Thank you.
Thank you so much. Thank you so much. Okay. So the Ben say quickly on responded to this questions now my now if you want to 3 so I can more the 2 January respond to them, and then we will say bye to our viewers and listeners. What are my Doc?
Export of nurses.
Okay. No, which one? If you want to start.
Okay, because Okasa,
okay, you start.
Questions that were asked.
Professor Bay, you start. Professor start.
And the quick one, they say, let me say, recruitment, and then the enrollment, improving the enrollment. Yasinipi, NDC Yasinipi, say we'll remove the quota system. And I showed you a letter, a quota system is in place. Restricting the number of students they can admit. Yasinipi said we'll scrap it. So that would automatically increase the enrollment because the schools have capacity. Now about recruitment, we are going to try to recruit as many people because this backlog election recruiting, we don't think it is fair. And the pharmacists alluded to that fact. And the figures are Dr. I was seeing some years I said they were recruitment, but we know from that 2020 batch of nurses, I don't know if there been any other form of recruitment I announce but if it is genuine, then all these people are at home. And I was saying, answer, we have to recruit them. The dialysis one, I didn't, or it was to both of us, but to me, I can't say. In a policy statement, manifesto no by in detail. But even in our 2020 manifesto, you can say we establish a national kidney and cancer fund to help. And it is the view of your party say capping NHIS now, which I think is the greatest sin. In fact, because there's a cardinal sin about where our costs to the health sector. If we uncap the NHIS, now almost funds are available. Actuarial studies can be done. They'll have enough resources that can support this dialysis. But me supporting the call and say we must increase our preventive strategies, so that we don't have a higher burden, and also look at transplant, which is the end therapy of kidney this thing. Then the I think
co-payment.
Co-payment. Yeah. Okay. So co-payment and then export. These are the things, and the community of Numajai. Co-payment can be legal. The system can decide to accept co-payment. health service is expensive. Somebody has to pay for it. So if we uncap this NHIS, nurses are available, and the NHIS can pay realistic tariff, co-payment will stop today. Because there was an arrangement, for instance, a do to say amoxiclav, Ukra private hospital, the amount of better amoxiclav, no, and the amount of NHIS is less. So who takes the balance?
Difference, no.
Difference, no. Into what a drone on the market at 15 cedis. NHIS or 10 cedis. So 5 cedis one a bit. That's where the co-payments come from. Okay. So government has to be frank with the people. Say, okay, I'm paying fully for the drug, so don't pay until I'm paying the amount you are buying it on the market. And okasa obey yes, then there will be no co-payment. Okay. And yes, I there. Me to me koto there 10 cedis. Now member embeton 8 cedis. Obi anyi ejuma moka. Okay,
so Dr. Sorry,
and then last one. Yeah. Let me say exporting of nurses. No? Yeah.
Like Cuba, that's what he's saying.
Yes, exactly. What is happening now? No, your buying is being cheated. You are practicing some sort of exporting. Be called Barbados nowadays. But what is happening is that a lot are migrating on their own, and no remittance or anything is given to the government for training these nurses. So I will support a system that if we think we have met our local supply, international partners will have an arrangement. Right. You pay something back to the institution, the country for training them. Instead of say the people will migrate on their own. And the danger of the migration on their own to the nurses now can say, who experienced nurse, midwife for her. But because of untimintia agent B and other things, no acquire carer, which is not what the person was trained for. Yeah. But they would have required that.
Professor Bayu, thank you. Dr. Sorry.
Thank you very much. May I hear from exporting of nurses? Yeah. There are international regulations to exporting of nurses. As I say, there is a nurse to patient population ratio. Initially, Ghana very high, 1 nurse to about 1,000. You see, in Badwam, there's a limit. I think it's 1 nurse to 500. That's the reason why NHS system from the UK omuntima had directly MF anko for no. As I remember in 2018, near Wales for negotiate. Say befa nurses ko 4 years no question bibi no back. Yeah, in Barbados, no, a South corporation. We are just helping them. But I mean, what Barbados coming fat tutors now ako set up nursing training schools. Am I on? So I may make a Into we are working on that one. Into once is a nurse a patient population Badwam. Into we are trying to get out of that. Then we will complete all these things and have a proper export system for nurses I train home. Then you can open even up even private nursing training schools. Germans for I catch you say oba obetima ke no mumra o baby no mun even German course while they are doing the courses no nurses no be akoye attachment. So all these things plans are put in place aye ho adwuma. Community of nurses name motorbikes nema. I think say we are one of the working a year. We Ghana Health Service you have to sit down and work on it because it's part of the work that you are doing. Tinise one auto motorbike, a part of the system. Bag and I'm system come because I say temane any chip we adwuma no any talk bags ni nyina ma mo. This is something we in here say even a policy within the health system they have to be able to do that. Any insecurity ni nyina you have to be secured. Insurance have to be in place. Something it's not even going to something that should be done. Private health associations of Ghana, release of health insurance. I don't know the figures that you are talking. You see, health insurance, both a reimbursement and also there are also some other aspects. They also have to pay themselves. And then the other aspects which have also to be used for health systems. Because, and yet, only the, but the percent, about 80% of the money are from releases. I'm sorry, you are talking about capping. Yes, the capping, Yamincha, the Ministry of Finance for, in principle, the capping, I'm sure is going, that we want to remove the capping. That's the reason why a lot of releases have been given. I'm so up to lower tier, up to April or so. and a higher tier, so up to March. It's better than young coffee be 1 year. But there is progressive things that we are doing. Sebeya, ebetimi aye, ama capping. Ideally, no, the no year cancer senka. Umunya sikano. I want say social security snake for the and go directly into national health insurance accounts. That is what you do. But you are also aware that these are some of the taxes government uses. The last one, co-payment eradication. Dr. Kambibi, my running hospitals there. Say, me kotoa de na ade canon so a hwan na ntuaka. But there are also other aspects of co-payment. Some will say, yeah, NTSC. Because we say, we payment na oje no. Usa ejisika, esa say, oh, what they come away. It be so under the table. But utuya health insurance and tentemwa, most of the time co-payment doesn't come in. Second point in is utuya realistic tariffs.
Yeah.
And so co-payment in them. And because of economic situation, as you said, inflation, and then exchange, you see, health insurance are putting in place. They've started doing the review of the tariffs. And we want them to do the review every year. Oko countries because we reviews, every 6 months. Japan for no, every 2 years because
Dr. Cesar, how is that lecture a lot of people in the
the capping if it is gone.
Yeah.
And then regular payment within the 3 months. Yeah. That's what health insurance will.
Okay, so back to our question.
Then there will be the co-payment will go down. And then putting in all the other necessary tariffs.
Just the questions. Yes, sir.
Yes, sir. Thank you very much. Bachelor Fremi Gabriel, Ni Otu Ankara, Christian Health Association of Ghana.
Good.
Let me admit that both governments over the years have really partnered CHAG in supporting healthcare in areas where government couldn't get to, the underprivileged areas. I want to tackle infrastructure, and it goes to both parties. Agenda 111, it's very good and laudable. What is the current government's plan for areas that Agenda 111 is yet to get there? But Christian Health Association of Ghana is there. You go to a place like Bono and Bono East, almost all the facilities there are for Christian Health Association of Ghana. Wow. What is the retooling plan alongside that one? The NDC, when they come, maybe they will decide to do Agenda 222. Whilst they look at it, what will that plan be? And then lastly, it is true, some of us have decided to measure policies and our leaders when they come out with their strategies. I want to know, current government, how much of your annual budget, the immediate future is 2025.
Exactly.
Is your budgetary allocation for the health sector. That will tell me how committed you are. And NDC, what is your allocation?
Thank you. Yes.
Me a midwife, into me kasama midwives. Me kasa me masam no call both parties. HIV. Asa man who subio. Na ye midwives, we are at risk because of delivery process. They be a yensada mojem 24/7. Me bisa say, and she say ben, and a maya fa who say, me mama HIV asaba form because emre bi etwem no near our advert educating in for what to do and what not to do on HIV. Now those adverts are no more in the system. Into me bisa say. Ye midwives na ye tu ye ho esi ho na ye gi nkofo awo ye nsada mojem 24/7 no e den hihye e na mo ye ama yen
yada say ma me fa che me ye nwaba.
Linda Ablo, representing Christian Health Association of Ghana. So my question has to do with regularity, and timeliness of NHIS payments. As it stands, we are trying to keep our heads above water. A lot of the facilities haven't been paid, have only been paid till December last year, and just a few have been paid up to January.
Okay.
So I wanted to know, most of the time, by the time the money comes in, it loses its purchasing power.
Okay. Okay.
So to Dr. Insia, what are they going to do? They are currently in power. What are they going to do to salvage this situation?
Okay.
And to Prof, what would they do differently when they come on board come 2025? Thank you.
My question no ekoma two parties nina. Number one, eto da yete strike ewo yen oman yi mu. Me pese me bisa say ade na yanka professionals neba with their issues yent na say na yen find the solution to near omodi aba se omu hia no say yent mimpo meet omo maybe halfway so that omo strike kra yet na wa ma lab professionals strike na ya to lab nimu operate enti no ye inconvenience the poor clients now on we thought that edro nya scanton to go to the private places enti me pese me hu say painful mienu parties no emredu na munye kwenya den am be ya fa going forward striking ho embakra
okay
na ebeba so ebesusu na kasa ni nyina so ase na ewo more on the clinical staff, nurses, doctors, midwives. We have what we call the supporting staff over hospitals almost supporting yejitum, but then most of the times the steering steer the affairs of the institutions or the hospitals. If an administrator is not well catered for, manage institution. Same way other supporting staff who say going forward no and then supporting staff.
Okay.
Thank you.
So exhaust.
Okay.
Pacho Medini Aisha upon and me question no comma two parties ni nyina. Obi can say so policies, better policies are Bragana. Na mejitum say and some of Makani in a great and very fantastic policy. But before policies nibe into being, I was say ye can't say we are it should be an action. For instance, we might midwife have something we say action and alert. We will talk. People will come and get ideas from us, go to their country and practice it. Come back again, you come and meet the same Ghanaians fighting over the same policy they've told to maybe someone from Rwanda, and the policy is working there. So my problem here is that I wish and pray that all these policies should be, if it is a good policy, it should be a national policy, whereby if NPP come, we are following that policy. If NDC come, we follow that policy. I beg to differ. Health doesn't have party colors, and everything that is going to be done in a positive way will affect every human being on earth. Thank you very much.
Yes, sir.
Yes, sir.
Good morning.
Good morning.
Pastor Yefremi Kwesi Apia Oduro, representing Christian Health Association of Ghana. My question is, my parties and it has to do with brain drain. As Prof said, the pattern has changed. As I say, it is the experienced ones who are leaving the country. And it's a big issue. It's not just about the knowledge and experience that is leaving. We also have to think about who teach the younger ones our mobile app. And, my question is to both parties. Yes, Ghana College came to help, but they say, the products of the Ghana College are also leaving. What are the parties going to do to ensure that we retain our experienced staff? Thank you.
Last two.
Okay. Pachomedase, Midindi Reginald, Sechi Brown. Senamika earlier on, I represent the Pharmaceutical Society of Ghana and I serve as the chairperson for the Young Pharmacists. I want to say a big thank you for the response earlier on the human resource plan, because all the pharmacists, especially young pharmacists, just as Doc Akawa has said, most of the young pharmacists are leaving. Only in Crawford 10 Kasa. 9 out of 10 are looking outside of Ghana. But my second question today has to do with the medicines in country. there were a few pharmaceutical companies are producing medicines. Currently, no OSHA data now, we only produce in country just about 30% of products are used, which is a serious national security risk. In fact, we endured COVID. COVID, most of the vaccines near the idea used at some point in time, whether it was the Moderna or PVN, most of them were outside, were developed outside the country and then donated to us. And, if as a country, we are producing only 30% of the medicines that we consume, that's a 70% are imported into the country. That is a very serious issue. And then we also know that we've had a lot of economic instability. Not just as anytime we have issues with Forex, and because most of these drugs are imported, we are going to have hikes in these drug prices. So, umame, anao papa, anao nia, anawan kasa, unya malaria draw, unya diabetes draw, unya hypertension draw. Now say most of these 70% of these drugs are imported. Salary ain't changing over a period of time. You can imagine. How do you cater for that? Thank you.
Pachomedasi, Midin de Gloria Ama Asma.
Okay.
Mijinemuma National Policy Crusaders Association of Ghana, woman organizer. Me pacho me question no both parties. National Health Insurance Scheme. Who say National Health Insurance Scheme public hospitals, a year juma. But when we come to the private hospitals now, a lot of them say use National Health Insurance as a marketing strategy. Consultation depend say National Health Insurance cover. Me person me bisa say power. Then after this particular issue
okay, so that's it. Professor Bayu and then Dr. Nsensari, you are not going to give us the responses now. In fact, our time is up. We are taking your responses by a close of Sunday evening to read them out Monday morning on Badwam, because they're very key to us. They say, share cameras name. Now quickly, what box your wrap up for 2 minutes? That doctor so I say na me empa nipa ensia mudi mo questions you try to on my and say onyame adoma for me to also benefit Monday mon ko so hwa Adom TV na me respond appropriately per their responses no emfa mamu nyina me damase. Yes. Okay. Now your party 2 minutes
make us say me da mo ase say anya akwanya we na yesi kwatukase obema adia tie ni din nyameka ne se nyama yeka wa ha nyina yi mo nyina mo atie bi assess the two parties they tie and then make a choice, and I'm sure says so tie ni nyina yi na so be make a choice now you would come to realize that the people that will give you hope, restore confidence in this economy is His Excellency John Dramani Mahama. Then na ose obeye or say he's going to take up the quota from health training institutions admissions. Obia betimi akobi. Or say muko school he would employ. And he's building more hospitals and he has made a firm commitment. Say oba health facilities are yen obe continue nowhere so that these facilities will not go waste. And this man is making a promise based on his track record, which you can trust. The final one I would say is that this brain drain is a major concern to all of us. But to reverse the trend in the brain drain, reset or mind way, you need to restore hope in the country. And you cannot have hope in a country where the elderly go and picket for their savings. You cannot have hope when government bonds can no longer be safe. You cannot have hope when people will tell you look up and then they are looking down. Okay. My final word, you cannot have hope when you have a national ambulance system. Which are 10 million Ghana cedis for a service contractor. And service, they are working for the government and on government payroll. Okay. Let's ensure transparency, and the only person that can do that is His Excellency John Dramani Mahama.
Professor,
thank you.
Bayu, we are so grateful. Dr. Nsasari.
Yo, the mechanic say, no correct, Quatrocaso will be a TDD. Now, wash it. Nipacrona or Casa, no, you say about where you got to a will be a or any so idea vision. You may say only vision, cry, a will be good book, you are lost. And will be our ambitions. And until a bandway, a pesse or ma a pumdine, a sin it in a sitter. A bandway, a buyer, or they if it be social interventions, health insurance. It be free parliament, and almost all the buy. By a crowd because of the health insurance in the buy. To say almost all the free SHS buy. No, going him so many a free parliament to coy. It's about we ever shed near ma. Ira a Kufuad President Kufoye or the health insurance buy a shimo kina. Ah, Kufuad betros or shimo kina. Na Ira ba miaso ba on swab a shimo kina. And memory baby will be a kubia or be a what you call green revolution. Yeah, day. And near my abbey for near my bem sebeya, a jumana yeno, a bit me aye, kama amaye. The tosum you know, a buy way a buy or buy a free 2017, ebe pemne, what me a 470,000. I be the almost fair be cry. Now Dr. Foko, Eco General, Eco demonstration. I into Yaka. Your foe be so to Yaneka. About way a buyer. Why ain't she say sebeya upon dinner call a fabia or Ghana beer, and yapumudinka upon dinner pa. I did a neema a dia see any idea be more juma, ni pado do be more juma, I can't dear be juma, say bit me do hontentem near funk or 4 M5 and also insurance you. I know you the abbey for near my ship. Nama the health insurance so a jina ye, a dibia crabbe. Ah, a pesse my health insurance. The 3 months na ye can wasem no eh wo mbrani mo no e betimi 3 months aye na sika eba health insurance nyina na eba health insurance ye de kana card any health insurance abo mu se be ya obia o Ghana card bia betimi access health insurance na ye tutu health insurance and katetem na afa nkofo wo adwuma mu na ahwe wo mu yi na brain drain no ya ye bida ye hu se nkofo okọ ye de postgraduate college by any man by a dig apomodin for you call different salary scale into a will push and pull factors. Okay, Kabumwa near yen kama na yet menya asumdue because so one kwa and our day or one swat and our own it health is worth and
Doctor,
then create also wealth from health. Ye ne private sector you nabe kambomu near incentivize private sector na and near ma a buying a private sector bit to ababwa ati afebia free.
Dr. Nsasari, thank you so much for your time.
And no na ba we person way.
Dr. Nsasari, thank you so much for your time. Na minna nyumekuya Ghana Registered Midwives Association, Community Practice Pharmacists Association, Pharmaceutical Manufacturers Association of Ghana, Pharmaceutical Importers and Wholesalers Association, Small Scale Pharmaceutical Manufacturers Association, National the Policies Crusaders Association of Ghana, Private Health Facilities Association, National Association of Registered Midwives, and Pachoma Kapchobia, is that correct? Christian Health Service, Community Health Nurses in Pamcho, Community Health Association of Ghana, that's correct, yes, Community Health. Intimida Munina Amase, in fact, at short notice, but there's very important associations about joining these great men in this country, representing political parties. On behalf of the entire team, I say thank you to Dr. Nsasari, thank you to Professor Bayu, and thank you to the various associations as well. Moji bre ede ebai. Wa utie share ewo fie biano titri yenyan ma mo ama no ne no enye easy. Mo still we've not exhausted it, but we cannot go beyond this time. Forgive us. Akwasin sia wa hanum say special aid to Mampo Adishe nyina. And then Oma Hende Kwabna Senses also a special aid to Ahafwadishe. We left out Efiama Kwatamakuru and also go so him from Kokra. Everybody, our technical team who be led by Yenyaba Martha and Dominic Welbeck Kofian Pedu. We say we thank you for your effort and Opemudia Gum and Listo will Health is key. Yeah. Health is major. In Tiekofino, what we have learned here and it's a yada Accra Digital Hana Professor Bayu Behajin Accra Digital Center for us yewo John Mahama Hall. In 2 weeks' time, we are back on sectorial debate. But Bakacho, on Monday, one day we say questions and we'll get the responses and read them back to your general public. We thank you so much for your time.
Yes.